Yes. Good morning, everyone. I think we have reached 9 o'clock, which marks the start of this seminar called Guinean Gatherings. I'm really happy to welcome you all here for this seminar, which aims to bring together researchers and scholars from different disciplines to investigate global inequality and to provide suggestions for innovative solutions, if possible. It's no coincidence that this seminar is held at Danish Institute for Advanced Study, where we are right now, which is an interdisciplinary blue sky research institute at University of Southern Denmark. DS has 3 pillars, and one of them is called wicked problems. And wicked problems was a new concept for me when it was introduced, but it is a term that is used for problems for which there are no immediate or even any solution. And definitely global inequality is a wicked problem. It's something we've been trying to deal with for centuries and decades at least, and with very limited luck. And global inequality is worth dealing with. It is, in my point of view, the greatest amorality of this 21st century, that we have a world which is so unequally, where goods are so unequally distributed. So DS, with its interdisciplinary approach to these wicked problems, is a natural place to gather researchers and scholars to try to tackle global inequality. And it additionally is a fact that SDU, University of Southern Denmark, has a good starting point with Bandim Health Project, which is a 47-year-old Danish-Guinean collaboration. And that has been centered around a field station that we'll hear much more about today, which since 2020 has been placed at University of Southern Denmark. So we have a good knowledge about Guinea-Bissau, we have good collaborations there, we have a good network, and a strong long-term partnership between the two countries that inspired us to use Guinea-Bissau as a starting point for studying global inequality. So with this in mind, with these 2 strong arguments for studying global inequality here at DS at SDU, we got support from DS to invite a broad group of excellent researchers and scholars from different fields who have been working in Guinea-Bissau or with global inequality. And I really like to welcome all of those of you coming here, traveling from far or closer on to be together with us and share your experience with your work in Guinea-Bissau. And I'm really thrilled as a health researcher myself to be able to learn more about the different fields, how they have tackled different inequality issues in Guinea-Bissau, and learn from that and from their experience. The idea I forgot to say about the wicked problems is also that none of these wicked problems can be solved by one discipline alone. We need a strong interdisciplinary approach to tackle these very complex intertangled problems. So today is a seminar open for all. There'll be a series of presentations and we'll break for coffee and lunch. I'll show you the program shortly. There have been some small modifications. And that seminar will then be followed by 2 days of workshop, where the aim with the invited speakers and DS and SDU staff to write a white paper and develop joint proposals. But today is a seminar, and it's really a time for anyone, except from when you are presenting, to lean back and enjoy listening to many different perspectives. I at least look very much forward to today. And I just want to end by thanking, I don't want to spend our precious time talking too much, but just end by thanking DS for the economic support. And they're not around here, but I just want to mention Malou, Susie, and Lamprini from the DS Secretariat, who have been instrumental. Many of you have been in contact with them in connection with the traveling. They've been instrumental in organizing this event. I also want to thank Mai, who is the Bandim Health Project administrator, who many of you have also met during this process, and Torben for supporting us with the IT. We hope things will run fairly smoothly with all the different presentations. So with that short introduction, just warmly welcome to the seminar, and I will leave now. I'll just show you briefly the program with the modifications, and then leave the floor to the first speakers. So unfortunately, and that's a fact when you deal with having an international seminar with participants from Africa, we had a visa issue. So one of the speakers, Namir Gomez, was not able to come. So that means that we have shifted the presentations so that we will have all speakers after. Namir will speak one slot before they were anticipated to speak, and we'll have a little more time for discussion by the end. So this is the program as it looks right now. We have 2 presentations, and then we'll break for coffee between 10:30 and 11. We'll have a lunch break from 1:45 to 1:45, and there we will invite you to see an exposition that Sune and Joanna have made in the library entry at SDU. So you will have a lunch, but you will also have a walk and the time to see the exposition during the lunch break. We invite all of you to come and join us there. We'll have a little photo shooting there as well. And then we have a coffee break in the afternoon, and again, wrapping up by the end of the day. So this is the program, and without further ado, I'll give the word to Peter, who will start the next presentation, which will be a joint presentation between him, Peter Aaby, Sabine Damero, and Elzbieta Pastucha. And Peter comes with a strong interdisciplinary background in person, sort of integrated in his person, because he is an anthropologist who ended up studying health sciences. And I think he provides a good example of why it's fruitful to combine disciplines, if not within yourself, then between different people. Sabine, I'll just briefly introduce you also while speaking. Hi, welcome. Yeah, Sabine is a postdoc in our group, and you also have kind of an interdisciplinary background. Maybe you will also introduce yourself briefly when you start your presentation. And Elzbieta comes from the science of technology here at, or engineering, what do you call it? The engineering faculty here at SDU, and she comes, she's an associate professor, and we'll talk about her experience with working in Guinea-Bissau. So this was a very short introduction to the speakers of the next presentation here, a joint presentation.
I hope you can hear me, because I cannot hear you. I'm too old, and the hearing aid is not always working perfectly. But I'm given the unenvious task of trying to introduce what is the Bandim Health Project. And I will try to describe very briefly what is Bandim Health Project just now, and why is it there, and can we use it for other things. It has to be said at the beginning that the Bandim Health Project, I don't know if you can see him, and we have been there for 47 years now, and it was clearly developed as a project in inequality in child mortality. So that was the basis. Bandim Health Project is a health and demographic surveying system, and we operate both in the urban area, Bissau, the capital, and then we operate in the interior in 220 villages, I think. And these villages are randomly selected within the different regions. In the city, where everything is closer and cheaper to make, we are also following the maternity ward, so all the deliveries at the hospital, and in the pediatric ward, we follow all the hospitalizations and mortality at the hospital. And at the health centers in our study area, we register all the vaccinations, and you will later learn why that is important. We actually get documentation on the vaccination. The fact that it's a demographic surveillance system means that we try to get, we start with the pregnancy. That's where all life starts. And a lot of demography is based on sort of retrospective data. And if you do that, you're not getting the early mortality, which is very high. You have to have information on the pregnancy to actually get the information. on the advice of demographers, Swedish demographer, when we started, they said that you ask what happened to the deliveries and the women will tell you, and they didn't. When we asked the question to the women, had they had a delivery last year, is it still alive? We were tenfold wrong. So it's only that by actually registering the pregnancy, you can get a truthful answer. So the women wouldn't like to talk about the dead children. That's understandable. But if you build your demography on that, you get wrong data. So demographic surveillance system also means that you have to map your area so you can find back. See, here we are in zone 5 in Bandim 1, and they are painting the number on the house so we can find back. And Bandim happened to be ended up being our sort of main area research, where we have done most of the research. So the numbers are still there. Sometimes they are on the door, and then people move and they take the door with them. So it gets some confusion. But we have maps where the real number is. And then in the interior, we have 220 villages, and they have been selected 20 villages within each of the region, so they should be representative of sort of the distribution in the country. So this is undoubtedly the best data in Guinea-Bissau on fertility. So we register the pregnancy. You can see the car here. Our team, mobile team, is moving around in the country and visit. The program is every 6 months. We should come every 6 months to get most of the deliveries. And then we follow the deliveries, and then we follow the children. And since this was about child mortality, our emphasis has been mainly on children, not on the total demography. It would be nice if we had the resources, but we didn't. So in the urban area, we have the demography of the total population, but in the rural areas, we have followed the women of fertile age, and they are now getting considerably older. But it's the women of fertile age we had registered, and then we followed them forward and all their children. And we followed them on to 5 years of age, because that's where most of the mortality happened. Actually, most of the mortality happened before 3 years of age. So in the urban area, we're only following the children to 3 years of age. It's a question of resources. How often can you come back? So here we are registering the pregnancies, the birth, the breastfeeding. Since this was a nutritional project, I will come back to that. We had a strong emphasis on getting information about breastfeeding, exclusive breastfeeding, etc. And then about growth. And we have initially, we measured growth by height, weight, etc. Now we measure it essentially by arm circumference. Arm circumference is the cheapest way to measure growth, and it's the best indicator of mortality risk, and it's cheap to collect, whereas growth, weighing the children or having their height takes 2 persons. So we are here. The third picture, I think you can see they are they're measuring the arm circumference, and then on the fourth paper. At a picture, they are taking the information from what the yellow thing is a vaccination card. So the vaccination card is sort of the identity of all the children. They come back here. So we, in a sense, we have introduced the vaccination card as the identity card, and we hope they will take it when they go to the health center. This is not a system which was there. We created it in the process to be able to follow the children when they come to the hospital. But it's also because vaccines turned out to be particularly important. So we try to get the information on all the vaccinations that the children have received. For the general population in the censuses, obviously age, ethnic groups I guess that's because I'm an anthropologist and the ethnic differences is quite big. So this has been part of the program. We haven't used it for very much, but that is the information on ethnic group, and the ethnic group in Bissau are very different. Then we collect schooling, partly because maternal education has been a main determinant of child mortality. And then possessions, if they have a radio or phone or etc. So those are kind of the basic information we are collecting, the quality of the house. But those are the basic information which is collected now, and it's the population is 100,000 in Bissau, and in the interior is 50,000 women and their children, but that corresponds to 100,000 people. So roughly we are following 13% of the population in Guinea-Bissau. So it's 1/8 of all people in Guinea-Bissau. But why are we there? Sweden was the major donor for Guinea-Bissau. And that's because Bissau was sort of a Portuguese province, and a lot of people thought that it shouldn't be there, but Portugal was part of NATO, so we could not say and criticize. But Sweden was not part of NATO, so they could say this is a horrible war here. And Sweden had actually recognized the independence movement already, I think, in 68 or 67. And the war ended in 74 with the coup in Portugal, and sort of the end of fascism in Portugal. And in that time, Sweden became the major donor of Guinea-Bissau. So they had a strong influence in what happens in the training of people in Bissau, and there was a lot of people in Bissau. At some time, there were up to 100 Swedes working in Guinea-Bissau. At that time, in the post-colonial period all over Africa, child mortality was a major issue. So a lot of the funding at that time went for child mortality, and Sweden had made a very simple calculation. They visited some of the rural areas and found that if you counted the number of children at 1 and the number of children at 5, half of them disappeared in the process. So they had a rough estimate that child mortality was 50%, and that was actually what we found the first year. At that time, everyone knew that malnutrition was the main cause of high mortality in low-income countries. You could ask any European or American public, why is child mortality high? And they would all say malnutrition. And to give you one very concrete example here of how people were thinking is that this is from the dean of the Johns Hopkins University, which is the major school of public health. And he wrote, children whose death might be prevented by measles vaccine are on the road to death, and their nutritional status is so poor that they are likely to die of any disease. Thus, preventing a death may not necessarily save a life, but only change the course of death. So it's really saying that vaccination is not worthwhile. And at the same year, Lancet had a paper which says, think twice before allocating scarce resources to measles vaccination. And Lancet was the major medical journal at the time. So that was the attitude back in the 70s and the early 80s. So what do you do then? In Sweden, invested in a multidisciplinary team or interdisciplinary nutritional research project. And there was a nutritionist, an American nutritionist, a Swedish pediatrician, and then an anthropologist, and I was just a supplement to the Danish anthropologist. And the job was clearly defined. We have to improve the nutritional status to reduce child mortality. So the Deputy Minister of Health sort of said, you have to tell us what are we going to teach in the children at school. You know, the party took the school to be the place where you could actually influence attitude. So you had to teach in the school what should they grow in their garden in order to be healthier. They didn't have much confidence in changing the mind of the older people, but they thought we could teach them in the school. And then we made the first nutritional survey in Bandim in December 78. It's 1,200 children, and this is 20% of the population. At that time, there was 60,000 people in Bandim. Today, there are more than 40,000. And if you look at the graphs here, the first is weight for height, and weight for age and height for age, and then weight for height. And if you look at the figures here, these are sort of the average for the population. See, we are very close to 100% of the international standard. So the children were not malnourished. And we had been sent out to find out how can you improve the nutritional status. And so essentially, we found 2 severely malnourished children. And of course, their mother had died, and the grandmother was trying to breastfeed, and that's not a very effective course. So, but you don't need an interdisciplinary team to tell what is the problem here. The problem was that the mother had died. So essentially, it made no sense. And I think humans are slow thinkers. We didn't actually take a consequence immediately, you know, that the whole problem was wrongly formulated. Since the children were not malnourished, we sort of lived with that and saying, no, maybe they are malnourished in the interior, so we can do it in the interior. And but then the American nutritionist, she was kind of more honest, you can say. She left. I have nothing to do here. You know, this is not my job. Find out what's going on. So we ended up with this. The rest of us was just confused. How do you handle this situation? And that meant that it was sort of an ambivalent situation. What really cleared the mind, I think, was that shortly after we had done this survey, there was a measles epidemic. And this is a very severe epidemic. 25% of the children who died of the measles. You know, 25% of the children who got measles died. This is among the highest case fatality registered in the records. It's sort of nearly parallel to when measles hit the Indians in North America or South America, then you would have case fatality of 50%. But having a case fatality of 25 is enormously high. And mind you, if you look at each of the column, you have the weight. I don't know if you can see the first column is the weight for age. There's no difference between the children who died in weight for age. There's no difference in height for age, and there's no difference in weight for height. So, and measles is the largest killer. At that time, measles was the largest single disease as a cause of death. So there we had found that there were no connection. What were we doing in Guinea-Bissau? The first question is, of course, why did everyone think that malnutrition was the cause of death? No real good explanation except that we followed what we were told at the university, and if you are told at the university that malnutrition is the cause, that becomes the belief. This is culture. The data is not there. No one else have had this data. This is by far the largest study in terms of death, measles death, where you had documented nutritional status. There's absolutely no connection. So this was a major contradiction. And that's part of the reason that I'm still there, trying to find out what could it then be. You know, we had made the mapping of the area so we could sort of plot where the children, the red ones are the deaths, and the green ones are the survivors of measles. And if you have a sense of patterns, you can see that in the houses where there's only one case, one green circle, no one died. All the deaths occur in the houses where there are several cases of measles. And I have a lot of data on that. So that's a very consistent pattern. What is the difference between cases with one case, houses with one case and houses with several cases? Yes, in houses with just one case, everyone got infected outside. They had a contact outside, they got infected by weasels, they come back. And in houses where there are many children, they would then infect these other children. This is called a secondary case. You are infected within the house. And that turned out to be the real difference. It's very simple, just that no one had looked at it. It's, you can see here, we've done far more studies now. This is from the 80s. But you can see here in the studies from Bandim, there are several studies in Bandim, and there are from Senegal and from Bangladesh. In all of these cases, you will see if you have a blue one, an index case, the case fatality is much lower than the case fatality for the secondary cases. So typically 3 to 4 times higher mortality for the secondary cases. And please look at the 3, which is called Sunderland. Sunderland is UK, 1885. It's Germany, 1861, I think. And then it's Blijdam, which is the infectious disease hospital in Copenhagen between 1915 and 25. So if you get back to Europe, European data when mortality was high in Europe, you see exactly the same pattern. So this has been turned out to be a very consistent pattern, and we have also shown it for chickenpox, polio, whooping cough, and RSV. So it's a consistent pattern. And you can't really experiment with these things, but in animal studies, you can show that the dose of infections is a critical factor for the severity of disease. So if you are sleeping in the same bed as the first case, you are very likely to inhale far more measles virus. And we have been able to show if you get a big dose, you have a shorter incubation period, and it means that your immune system cannot follow. That is shown in animal, and we could sort of we cannot document it fully in humans, but you can sort of measure that there is a difference in the incubation period when the children dies. So all the logic is there to say that the real problem here was not the malnutrition, it was the dose of infection. And why would they get a bigger dose of infection? There's something called overcrowding, that you put a lot of people in the same room. And in Guinea-Bissau, they built very large houses. And these 13 children and the very small one are not here. They are probably on the back of the mother. These children live in one house. So it's like living in the kindergarten. And there you, of course, get a lot of children who get intensively exposed. In Bissau, 65% of the children were infected at home. It's an enormous figure. And in Denmark, it would be, well, measles is gone, but we probably had very few who were infected. And in the last term, well, this is more complicated. If you actually get infected in the kindergarten, then it's not very severe. So if you have public institution where the children meet, then disease gets less severe. Whereas if you don't have the public institution in terms of childcare, they would be infected at home when someone come back from school. So in the old days, 100 years ago, the school was the center of measles transmission. So the older children of 6 or 7 got the measles in the school, they come back, they infected their smaller sibling. Sorry. Children Christina is pointing to the watch. Sorry for talking. In Bissau, there were no vaccination program at that time. And given the very severity of the measles epidemic, we managed to get measles vaccination from Sweden. So we made the first campaign in December 79. And we vaccinated everyone who were home, a few people who were traveling. There would always be 10 to 15% of the population which was traveling to the rural areas to visit family. But everyone else were measles vaccinated if they were under 6 years of age. And something very strange happened. If you can see here on the first column, in the first year before, the gray one is before the measles vaccination, mortality in Bandim was 13% in 1 year. Then measles vaccine is introduced and it was threefold down to 4%, 4.5%. No one have looked at that before, and I have subsequently been able to find apart from our own, there are 4 other studies where you actually have the data. What is the mortality level before the introduction of measles vaccination and after the introduction of measles vaccine? And mind you, there are 2 studies from Senegal, one from Zaire, Congo, DR Congo, and then one from India. And they all show the same thing, that mortality reduction after introduction of measles is at least 50%. That's an absurd reduction in mortality. Why? How is that possible? So measles apparently, measles is not 50% of the mortality. So measles vaccine apparently protected against too much. Is that possible? Not in the textbook at the universities. But in real life, if you observe real life, this is definitely possible. And there are a lot of consequences that I won't have the time to give you all the examples, but just a few things. When we started in 78, we should actually have made rural development. You know, the donors of that time thought that development in Africa should be in the rural areas. So we had to strengthen the situation in the rural areas with schooling, better nutrition, etc. And so it was agricultural which should be developed. What happened was urbanization and dependency on foreign aid. Population in Bissau at that time was 100,000, and I guess it's around 400,000 now. Child mortality was 50%. So every second child died before it was 5 years of age. That has declined dramatically. So there are many more children, but not a lot of training. Bissau was very clean at that time. There were no cars, there were no plastic. Today, it's black plastic bags everywhere. There's old cars which have been broken down because there are no spare parts. So the whole place is a churchyard for old cars. At that time, there were enthusiasm. They got rid of the tugas, that was the Portuguese, and they wanted to make their own development. Now, there are no jobs. So everyone wants to work in Portugal to be a musician or a football player, or they will end up in the building industry if they get to Portugal. And then politics, PAGC, the Independence Party, who had fought the Independence War. Instead, now we have big houses for the generals, and we have had a lot of corruption. At one stage, Guinea-Bissau was on Transparency International. Bissau was the most corrupt country in the world. So what happens? The generals started fighting, and the president tried to get rid of the head of the army, and the head of the army wasn't likely to step down. Then he got the neighboring country to enter, this Senegal and Conakry. They came in with the troops. So in 98, we have a war where everyone fled the area, or the urban area. So there was only dogs, very old people left in the city, plus some soldiers, and they fled out of the areas. And the project tried to follow this, so we actually have quite a lot of data on what happens in an emergency. How does people react? What do you follow? And we could actually also study some of our health issues in that situation. I'll give you one example, and this is one of the things which Bissau is rich in. This is a natural experiment. It's something you could not have planned. No ethical committee would have permitted this study, but it happened because the war was there, so there were no measles vaccination. So we were doing a study where half of the children got measles at 6 months and half got as a control vaccine, they got inactivated polio vaccine. And then at 9 months, which is the official policy, everyone should have had measles vaccine. But since there were no vaccination, they didn't get it. And therefore we could actually do a randomized study on measles vaccine versus a placebo or control vaccine. And if you see the survival curve here, then the mortality of the measles cases is actually 70% lower than those who did not get measles vaccine. So that's very similar to the other data I showed you earlier. These things are actually possible. It's not in the textbook. So we were sent out to reduce child mortality. We succeeded. It was not really us who succeeded, but the system succeeded in the period that we have been there to reduce child mortality with 86%. This is an absurd reduction in mortality. I don't think there are any similar reduction in human history where mortality declined so rapidly as has happened in the last 30 years. And if you look at the curve here, it goes down, it goes up, and then it goes up and down again. That suggests, this is the curve of the five-year mortality. So it's kind of indicating we don't really know what we're doing. If we knew what we were doing, it should go down like that as we become better and better in predicting. Sometimes we do something and it works. Sometimes we do something else. It doesn't work. It's actually harm the situation. And if the pointer here the first one here is the measles vaccine when we introduce that. The second one going down is BCG, the vaccine against tuberculosis. Here it's measles again, we get it in even earlier age. And here it's OPV, which is oral polio vaccine. And those are the three big ones. Those are the three big ones with reduced child mortality. And what's characteristic for those is that they are live vaccines. They stimulate the immune system, and therefore they can have totally unexplained effect. This is not in the textbook because we only look at the specific disease that the vaccine is against. But the immune system is not made at the university. The immune system is made in reality, and you have to look at reality to understand what's going on. So this is sort of our legacy. But the question is, did we succeed? We did succeed in reducing mortality, but none of this has become public policy. There are a few examples, but generally we have not been able to get through with the policy implication of these observations. So to take it from here, could Bandim be used for something similar in other areas? And I think it can. The strength of Bandim has been this built continuity in data collection. And you can actually come back later and see why didn't it go wrong? You can control long-term effects that's rarely controlled. You only do surveys. You can find the contradictions. In everything I have said, the key message is follow the contradictions. That's where you find the information which is important. And then secure that all data are consistent and check the natural experiments. So those have been some of the things that we can do, and I hope other people would use the same. You could study migration, you could study fertility, you could study schooling. So to end here, I will say, why am I still, after 47 years, in Guinea-Bissau? From the point of view of someone who wants to learn something, it's an incredible experience to actually be in the field, and instead of sitting in a university where people are debating the latest French fashion in interpretation of data. What happens out in the field is that you will see you were wrong. You get a sense that you may actually change something which makes a difference. And it's much easier to start a new study. The basic problem of people who are sitting in university, every time they get a new idea, they have to have a new funding. But we are in the field with a few additions. We can actually start a new project to follow up on these issues. And then there are a lot of natural experiments. So it's easier when you can go back. We have gone 20 years back. We got a new idea. When we go back to the data we had 20 years ago and actually find out that it was good. So, and it's easier to triangulate data because you have data from many different sites. Unfortunately, the medical profession is sort of living with a paradigm with the randomized trials being the only real truth, but you can't randomize everything. Most things you cannot randomize. Therefore, you only know very limited things, but in the field, you can triangulate all the data to see whether they fit. And that's what the anthropologists are doing, and you can also do it in public health, but it needs other kinds of data. And maybe it's easier to make a difference if you are out in the field. I hope so, but I haven't proven it yet. So welcome to Bandim. You should expect the unexpected. You should believe in no assumptions. You should follow all the contradictions. And this signpost here in Danish is, where the hell am I? But there's only 2 kilometers from here. You will have 2 kilometers to where the hell am I? If you find the place, you may actually be able to break a paradigm of inequality. And that's rare, and you should follow it. And we will be happy to help you in Bandim. I don't know if I'm into bragging sometimes, yes. So I will end by bragging. No one had this idea about the vaccine's non-specific effect, that they actually do immune stimulation. But during the COVID epidemic, a lot of people sort of were reminded, maybe we can use these effects against COVID. So many trials were started with measles, with polio, with BCG. Most of the study was with BCG. This is just a rough listing of the studies which had mortality data. There were 15 trials in all, and 9 of them had mortality. And if you make a meta-analysis of these trials, the reduction in adult mortality is 51%. This has virtually nothing to do with, a little bit with COVID. There was a 50% reduction in COVID mortality as well, but a lot of other things went down. So we can actually stimulate the immune system, but that demands a total change of mind. But please note that this is potentially a way to introduce vaccine equity, because we already have that vaccine. Instead of waiting for the vaccines coming from the industry, we can use these things which are already there, and it's a way of introducing equity in survival. Thank you, and welcome to Bissau.
Thank you very much, Peter. I will let Sabine continue talking about how it is to come to Bandim and work on projects. Can you hear me? Yes.
Can you take this off?
Yeah. And while I'm doing that, maybe keep it on, Peter, just for a second. I'll just take one question for Peter, if there's one. Yes, Joana?
So much for this Really to have such a body of data for so long, and how were you able to fund it for so long? Was it ever interrupted? Was it a struggle, or could you rely on 47 years of uninterrupted funding? It's so incredible to be able to do this.
Yes. No, it's not possible. It's not possible to have those kind of funding, and particular if you are controversial. Everything I've said is deeply controversial in relation to those who sit in the funding agencies. This is contradiction. This is clearly saying we didn't do our homework before we started our project. We did not test our assumptions. And you don't say that to the medical profession without getting harmed, unfortunately. And Julia is, it's true. I have been fighting in the medical profession for so long. We did manage, and for some time it was Sweden funded us the first 5 years, and then they stopped because it was too controversial. They didn't want. Then I have been funding from medical students organizations, and sometimes we've had Novo funding. So, but it has. As we are talking here, we are submitting new proposals to keep the place alive. So, I had periods with no funding, but we continued the work anyway. During the war, we got quite a lot of sort of international funding because it was an emergency. You said, it's sitting on a gold mine of data. Yes, it's also a nightmare in the sense that it's sort of challenging you that there's so much data, and I don't have the time to analyze all of it. It's very easy to collect more time than you can actually analyze. And just at the moment, in Denmark, we are heavily criticized for one study we didn't publish. There are several studies we haven't had time to publish. Those kind of things happened. But it is a gold mine, and those who have good ideas are welcome to come and exploit them.
I will give it to Sabine.
Yeah.
Oh, does this work? Yes, perfect.
Sorry for talking too long.
Good morning. So I would like to now, well, as Christine said, introduce a little bit to some of my perspective of what it means to do research in Guinea-Bissau, which I have had the privilege to do over the last a little bit more than 5 years. First as a PhD student, and now for the last almost 2 years as a postdoc. My focus is on health systems research, so everything now is a bit from the health systems research angle. And I will focus on collaborations with international partners and local institutions. So when doing research in Guinea-Bissau, there are mainly, well, from my perspective or experience, there are 2 key challenges which are not unique to Guinea-Bissau, but very common in low-income settings. So the first one is that, well, we largely lack robust data from administrative systems. So I give a few examples here, and probably the most striking one is the population in the country. Actually, at this point, we do not know how many people are living in the country. We do not know where they live and what their socio-demographic characteristics are, and how those are spread over the country. The last census is from 2009. Meanwhile, births and deaths very often go unregistered in the official systems. So that creates problems very obviously. So for instance, when evaluating health interventions, well, while it's already a bit tricky to know the denominator, so how many people are reached with an intervention or how many people have died despite being targeted by the intervention, it's quite tedious because very often you have to go and actually look at these paper-based forms or books in the health facilities. But when it comes to denominators, so for the target population, there you actually have to shoot in the dark. You don't have the full overview. So, and which leads to many evaluators, reaching estimates that are sometimes exceeding 100%, where we know, well, that's based on unreliable basic data we are working on. So things are complicated when it comes to the administrative data. At the same time, and that leads me to the second challenge, systems are, well, complex, dynamic, and constantly evolving. So, and with the angle from the health system, one key contributor to this is that there is a very, very high dependency on external funding for health. And that has the consequence that we have many, 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 many different stakeholders operating in the country. And these are just some. There are many, many more, also NGOs and so on. And well, by definition, each stakeholder comes in with their agendas, with their priorities, creating obviously vertical systems because it's focusing on one area. So then you also have the risk of overlaps, of overlapping mandates, overlapping activities, and so on. So these two challenges, a lack of robust administrative data, and just very, very complex systems require that you actually know who's doing what in the field and establish strong collaborations, and then fostering stronger data systems. And at the Bandim Health Project, we are committed to fostering both. And I'm going to give you a couple of examples here. Well, with the first one being the example that I've spent the last 5 years working on, and that's a collaboration we had with the PIMI project, which is funded by the European Union. And well, in the interest of time, I won't get into too many details, but PIMI is a large-scale health system strengthening intervention, has been implemented in the country since 2013. And the essential idea is that you can see it over here, that on the bottom, it's a very comprehensive intervention package of intervention targeting key weaknesses in the health system. Through those, the theory of change is that you enhance the coverage of essential maternal and child health services, and thereby you improve the survival of mothers and of children. Well, now thinking back to the lack of administrative data, it's actually for a funder coming in and doing such a big intervention, it's really hard to know what happened. Did it work? Were they able to fulfill this theory of change? But this is where our work makes a difference. So Peter already introduced you to our rural health and demographic surveillance system, so I will keep this super short. So with our surveillance system in the rural areas, we are constantly out surveying the health, the survival, the health intervention uptake in the national representative cohort of over 50,000 women and children. We go to the villages twice a year. We go from household to household, and then we register in migrating women who have reached fertile age. We're registering pregnancies, birth outcomes, thereby also survival. And we are registering the uptake of any of essential health interventions. And that basically gives us both the nominator and denominator to do such an evaluation. Well, and based on that data, we were actually able to observe that, well, during the implementation of PIMI, and here you see the development from blue before PIMI to green during its full-scale implementation, service coverage has actually impressively increased. But on the right side, you see mortality, and that's perinatal mortality, and that remained very stable on a super high level. So we tried to dig further to understand, well, why was that the case? And then actually went out and did further data collections. So we went to providers of health services. We did in-depth interviews with a very nice collaboration with the National Institute of Studies and Research. Bucar Indjai is here. And in addition to that, we went out to the communities, to the villages, to actually also talk to women and dig a little bit further. And based on this, we were able to identify actionable points that we then feed back to the funders of the intervention, back to the ministry. And I'm very happy to talk more about this over coffee, but time is a bit limited. Another project we are currently launching, where we are also, well, strengthening collaborations, is a project where we research a pilot project for the moment, where we are researching the climate impacts on the livelihoods and the socioeconomic well-being of women in Guinea-Bissau. And that's a project where we are actually using the urban side of the health and demographic surveillance system, and will be conducting interviews and observations with different stakeholders with the aim to foster, or to identify points to foster female empowerment. And I'm sure that Maria would be available to talk a little bit more about this. Well, and finally, a project where we are currently strengthening data systems, and I'm sure that Christine would be able to talk a little bit more about this, is where we, well, also in a collaborative project, went back and digitized climate data, so rainfall data and temperature data, going back to the 1950s in the country. And that, you can imagine, then together with our surveillance systems, there are tons of beautiful opportunities of linking data and looking quite far back into the past and yeah, exploring different research questions. So this was a brief glimpse into research in Guinea-Bissau. If you're curious to hear more, please find me or write me an email. And I think I'm handing over to Elizabeth. No?
Yes, so the last, thank you very much, Sabine. The last speaker here is Elzbieta, who will be talking about a project that she came and did from the Faculty of Science Engineering.
One slide is for Cintia.
And one slide is for Cintia also, yeah. So this is an example of how the field station has now become a basis for doing research within other and doing projects within other fields that Elzbieta will be presenting. Yeah, in the interest of time, I'll just move directly to you. And Sabine, you should definitely talk more about the PIMI study and the surprising observations you made, I think, at a coffee break or somewhere.
And yes, I'm from the tech department, so this is a little bit embarrassing. Yeah, so it's a little bit daunting to follow Peter and Sabine, because Peter 47 years, Sabine 5 years, and I have a combined experience of 3 weeks in Guinea-Bissau. Also, I didn't do research in Guinea-Bissau, I did teaching in Guinea-Bissau. So we came with a project to do some teaching of drones. Now, Cintia, could you just a couple words here?
I just say like this. It's on one slide. We just wanted to give a background why we wanted to study the coastal ecosystems in Guinea-Bissau and do some teaching. And I made this slide just because we have a global importance of the coastal ecosystems, and also a little bit teaser to our connection between Denmark and Guinea-Bissau as such. Denmark and Guinea-Bissau share similar coastal ecosystems. We have intertidal mudflats and coastal wetlands. The difference is that in Denmark, we destroyed many of them, and in Guinea-Bissau, we still have many of them. And the map there is just to show you that we are linked in some way or another. The birds that live in the Arctic, they use, first of all, the big point is in the Wadden Sea in Denmark. when they need in the winter to move it south. So the first stop point is in the Wadden in Denmark, and the second point, the big one, is in Bikajos. So just to show you that there is a big importance, and then they continue moving downwards to South Africa. So that calls the East Atlantic Flyway. The coastal ecosystems, they also store a lot of carbon. And this is a nature value that is not really clear and explicit yet from Guinea-Bissau, and we want to explore that further. What are the nature values? And we know there's a lot of organizations, but as Peter say, we need to make it applicable. Can we do that? Can we have some policy? And for that, we need to survey the coastal habitats in Guinea-Bissau. We don't have very good resolution yet. So that's why the drones are really good method to know the size, the types, and to implement policies and conservation actions.
Okay, perfect. Okay, so the training that we did in Guinea-Bissau, it was a 3-week training. There was a team of 5 people coming from Denmark and 2 amazing translators, because none of us speak Portuguese, that helped us do the teaching. It was organized by the Ministry of the Environment, and then UNDP was doing the financing for it. And we were supposed to have about 10 students, ended up to have 25. We were teaching them basic drone operations, where to fly, how to conduct the operation safely, doing practical skills in the field, but also talking about the legislation that is not yet that harsh in Guinea-Bissau, so actually you can fly wherever you want, which is quite surprising compared to the rest of the world. But then we also talked about data processing, what can we do with the data, and how we can utilize it in the work of people that joined the training. Now, we had people from Ministry of the Environment, we had people from UNDP, we had people from EBAP, also from the Meteorological Institute that were joining, so there were very different perspectives. But what we identify in that 3-week training is quite big lags of technology that we produce in the West that we're trying to implement in Africa. So to start with, the drones, batteries live maybe 4 months, and then they're dead, and there's nothing to change that with. So we came down with 3 sets of drones that they were to be staying in Guinea-Bissau for them to be able to fly with it. But then at this point, they probably don't have working batteries anymore, so they will not be able to fly with them anyway. And getting the batteries to work, working batteries in is another problem. It's not that easy to get spare parts in Guinea-Bissau. If the drone crashes, if the propellers break, it's not like in Europe where you can go to a shop and pick up something new. You can't do that in Guinea-Bissau. Then you've got the community around, and then the people that we worked with, amazing people, very talented, easy to teach, easy to work with, would do it 1000% yet again. However, and they do go out in communities, they do go out, I hope they go out actually. I do not have data on it. The environment in which they have to operate is extremely harsh, and you probably all know that way better than I do. I do not deal well with over 30 degrees temperatures and humidity in the 90s, so that was my personal environmental hell, but we could see our students also struggling in the heat in the middle of a day, and that's the time when it's the best to gather data. There's no point in flying in the night most of the time if you want to observe the mangroves, not the animals in the mangroves, but the mangroves themselves. Now, the population is very ripe to, and they want to learn. We had a couple of times, we've been to the Bijago Islands for 1 weekend, and we had quite a lot of young students that wanted to join and experience the technology, and that was really fun to look at them. And now to talk about why we want to introduce drones and why it would be great to implement drones in Bissau. This is the resolution that you get from the publicly available satellite data from the Copernicus missions. We have here a 10-meter resolution. Now, what do we see here? Well, just, so in the bottom right corner, you've got the sea. In the upper right corner, you've got the city of Bissau. And on the left, you've got a little bit of agriculture with mangroves in between. Now, this is the Google Maps image. Now, that would be a resolution about in between 10 and 20 centimeters. I'm not sure, because obviously they will not going to give you that data. That was taken from a plane with cameras in the plane. Now, this is very expensive to have that. Obviously, Google has about 250 planes that regularly survey the Earth, but they are not going to be flying over Bissau for us to monitor how the mangroves are progressing or how the farms are encroaching on the protected areas or what's happening with the nature. So that is not the data that is available, and it's not financially available to Bissau to be being implemented. And then we've got the drone acquisition, which we have a resolution of 3 centimeters, so you can perfectly see what's happening. Now, the problem is that we can't cover that big of an area as yet, and then the technology is failing in Bissau, so we need to work on that so that the technology is a better fit for the harsh environment. That's how it looks up close, so maybe even a bit too high of a resolution. Not necessarily need to crack the to track the cracks in the pavement and things like that. Yeah, so that will be it for me. I would love to talk technology with you if you want to. Yeah.
Thank you so much, Elzbieta, for the short introduction, but very clear introduction to how, maybe just a little word or two about how it facilitated this project to be with the Bandim Health Project, or having that as an anchor point for those who might be interested in this.
Yes, so the idea is that we introduce drones and we come into Bissau to be proven to be a little bit helpful, and so that we can open avenues to pursue projects so that we can help with monitoring the mangroves, the environment in Guinea-Bissau, but also to be helpful in any way possible, because I strongly believe we need to give back.
Thank you very much, and we'll move on with the next presentation. As slightly delayed, so we will cut a little bit of the coffee or prolong the coffee break in the other end, so you're not up against too much pressure. Camilla, I'm really pleased to welcome you here. We only know each other from quite recently, but you have worked for many years with the UNDP in Guinea-Bissau, and with a special focus on human rights. So you will take over here. We're leaving after this first introduction to the Bandim Health Project and various collaborations that have sprung from the Bandim Health Project, to now talk more generally about the situation in Guinea-Bissau. Will you provide it? I am not even sure I know your background, Camilla. Yeah.
About now? No, yes. Just try to do this. So, good morning. I think I am the odd one out from all the presentations, so bear with me. I am from the boring part of the university. I'm a lawyer by training, so I do apologize for that, but that's what you get stuck with today. I've been working, though, with international human rights law for all my life. I haven't practiced law much, but I have worked with human rights and how to support states and civil society to better implement international human rights laws and procedures within their countries. I moved to Guinea-Bissau in 2021 to work with UNDP, the United Nations Development Program, and work with the National Assembly and the Ministry of Justice. And then I moved to the Office for the High Commissioner for Human Rights, with whom I worked from 23 to, last July. And now I'm here. When I saw the program, I was really like, who is my public? What I'm going to talk about? So I'm going to very shortly present a few concepts so you know what I'm talking about, and then I will go more into Guinea-Bissau. So what are human rights? According to the Office of the High Commissioner for Human Rights are rights we have simply because we exist as human beings. They are not granted by any state. These universal rights are inherent to us all, regardless of nationality, sex, national or ethnic origin, color, religion, language, or any other status. They range from the most fundamental, as the right to life, to all those that make life worth living, such as the right to health, education, work, food, liberty, freedom of expression, etc., etc. So this is how the international human rights protection system is formed. So the whole thing gets inaugurated, as we know today, in 1945 with the UN Charter. And the UN Charter says that everybody has human rights, but it doesn't define it. So 3 years later, after a lot of discussions, you have the adoption of the Universal Declaration of Human Rights that creates the Human Rights Commission that does not exist anymore, that now has become the Human Rights Council, that it's the UN Human Rights Authority. But it's a state body, so it's made of 47 states that decide what human rights is, how it should be interpreted, who does what. And as you know, you've probably seen it's heavily criticized because it has no, it's not the General Assembly or the Security Council that can make a resolution that people have to follow. So sometimes the resolutions and the decisions from the Human Rights Council can be quite fluffy. And that's a thing that is contested a bit. But what happens is, today you have people say, no, it's jus cogens. Jus cogens is a law that is accepted by everyone that doesn't have to be codified. But the Universal Declaration of Human Rights, it's just a declaration. It's not law, it's not mandatory. So you have a period from 1948 until 1965 where people are discussing, we need laws. We need these to be mandatory. States, too fast? Okay, states have to adopt this legislation. So in 1965, the first international convention is adopted, and that's the Convention on the Elimination of All Forms of Racial Discrimination. When this is adopted, people go, yes, we can make laws now. This one passed, we can create others. And from 65 to today, 9 international human rights conventions have been adopted, and they are what we call core human rights conventions. And here they are, a lot of acronyms for you. Sorry, but you have the 2 covenants, so the ICCPR and the ICESR, which are the International Covenant on Civil and Political Rights and the International Covenant on Economic, Social, and Cultural Rights, both adopted in 1966. Then you have the third, that is the Convention on the Elimination of All Forms of Racial Discrimination. Then you have the CRC, the Convention on the Rights of the Child. And I will just ask this because it's a fun anecdote. Do you know how many countries are there in the UN system? No? Huh? 93, almost there. That's very good. So 193 countries are part of the UN system. Do you know how many have ratified the Convention on the Rights of the Child? All except 1. Yes. Do you know which country has not ratified the Convention on the Rights of the Child? The United States. I find this hilarious. So it's the only country in the whole world that has not ratified the Convention on the Rights of the Child. Then we have the CRPD, which is the Convention on the Rights of Persons with Disabilities, arguably the most comprehensive human rights convention, even though it's on a specific group, people with disabilities. It is the convention that brings in both civil and political rights and economic, social, and cultural rights in a very detailed form. You have the CED, which is the Convention on Enforced Disappearances. You have the CEDAW, the Convention of Elimination of All Forms of Discrimination Against Women, the CAT, the Convention Against Torture, and the CMW, the Convention on Migrant Workers and on the Rights of Migrant Workers and their Families. This is another very, very interesting convention because it too has been ratified from most countries in the Global South and no countries in the Global North. And none of the big regional powers within the Global South have ratified the convention either. So South Africa hasn't ratified it, Brazil hasn't ratified it. So it's a convention that brings rights for migrant workers and their families, like the right to education, the right to health, but everybody who actually receives the migrants hasn't ratified it. Then it's not, we don't have like core human rights conventions, but we have other conventions that you might have heard of that do make part of the international system as well, like the Convention on the Prevention of Genocide, the Convention on the Rights of Refugees, and several others that are not core human rights conventions, but that we work with them in international human rights perspectives. And then we have regional systems. So we have the European Court of Human Rights, we have the African Court of Human and People's Rights, we have the Inter-American Court of Human Rights. So we have regional systems working on the protection of human rights as well. And what we say is that none of this makes any sense if we don't have a national system of protection of human rights. So the entire system needs to work together for us to have human rights protection effectively for everybody in a territory. That was very short international human rights law in a nutshell. And what is access to justice? Access to justice is a term that can mean different things depending on the circumstances. At times, this can be problematic, as people may think of different meanings of the phrase when discussing this area. So, for example, sometimes lawyers will use the term remedies when discussing legal processes, such as judicial review or tribunal adjudication, and sometimes they will be specifically referring to the court order. So, for example, the judge has decided you have to pay damages to this person. So only this will be referred as a remedy. There is no set of definition of access to justice. So you see UNDP publishing something, OHR publishing something else. But here, in this context, and also what I think it's best applicable to the context of Guinea-Bissau is that it is a journey that starts when a person experiences a violation of a right and ends with an outcome that addresses that violation in an effective and comprehensive way. So, for example, access to adequate legal processes that result in effective legal remedies. But it can also be, and I think it's quite interesting because we are in Denmark to talk about, I don't think anyone, have you ever heard of the project called the Rule of Law Index? It's not my public at all. Okay, sorry. So there is this huge, it's like the Transparency International data or Gender Equality Data Index. So you have a Rule of Law Index that covers 170-something countries. Guinea-Bissau is not there because of something Sabine says, lack of administrative data. So it's very difficult to see how the justice system works because everything is on paper. It's missing. I don't know if you've seen a decision from a judge in Guinea-Bissau. It's usually on a piece of paper. The judge writes the decision and signs. Nothing is printed. And so the Rule of Law Index determines like the best countries own access to justice and rule of law. And usually Denmark is top 5. Many years is the first country. And you think like, but you don't even hear much about courts in Denmark. People don't use the legal system that much because it's super expensive and legal aid is not sponsored by the state. So you avoid the courts in this country as much as you can because it is expensive. But how come the country is within the first top 5 year in and year out? It's because when you talk about access to justice, it's not only about being able to go to court, but it's having the framework to act and have your demands being responded for. And my favorite example in Denmark is going to, like, if you live in an andelsbolig, which is a kind of communal living where you pay a little less for your apartment, it's not as expensive, you kind of own it, but you own a share in that building. Those andelsbolig, they have a lot of fights between neighbors. And they have within them mediation and conciliation processes that try to bring these people to find a resolution to their issue. And then the problem is solved. Nobody has to go to court, nobody has to call the police, the justice system is not even involved. But you have a grievance, you have a problem, and you have a system that operates to provide you with answers to your problems. And that is also access to justice in a broad way. And here is what we think it could be very interesting for Guinea-Bissau. So before going to access to justice in Bissau, let's talk about human rights in Guinea-Bissau. There are very positive aspects, actually. Even though the constitution is to be changed and it's been in a process of being reformed, human rights are enshrined in the constitution. So it is part of the constitutional text that you have the right to life, the right to freedom of expression. So the legal framework is there. Guinea-Bissau has ratified 8 of the 9 human rights conventions. So the only one that Guinea-Bissau has not ratified is the Convention on Enforced Disappearances. The country has an institution that aspires to become an independent NHRI, a National Human Rights Institution. So I know there are some Portuguese here. So the Provedor de Justiça is the Portuguese NHRI. In Denmark, the Danish Institute for Human Rights is the Danish NHRI. In Germany, the German Institute for Human Rights is the German NHRI. So 88 countries in the world have a national human rights institution that is independent. And Guinea-Bissau has a National Commission for Human Rights, and now they just changed the law and citizenship that aspires to become. So you have something there that wants to be. And for good and for bad, state officials within the Ministry of Justice, within the Ministry of Foreign Affairs, they know that they have challenges in promoting and protecting human rights. It's not something that is unknown to them. And it's something they speak publicly. So many states where you know, states that are known for human rights abuses, the state officials, you say, no, we didn't do that. It's not our fault. No, but we do everything to respect the rights of persons with disabilities. We're not, and so they don't recognize this, where in Guinea-Bissau, there is a recognition of the challenges and the things you have to do to change it. Article 29 of the Constitution recognizes the prevalence of international human rights in the national legal order, which is another very good thing. So it says that all laws in Guinea-Bissau and all conventions have to be read in accordance with the Universal Declaration of Human Rights. So there is this idea that human rights, international human rights law prevails. The lawyers trained in the Faculty of Law of Bissau, they know about these concepts, which is also very good because they know about Article 29 and its importance for the national legislation. The country is working towards the development of an NMRF, which is a national mechanism for implementation, reporting, and follow-up. This is a mechanism that will take recommendations for the international human rights system to be implemented in the country. So on an NMRF, we'll talk to the Ministry of Health, with the Ministry of Interior, with the Ministry of Education, and say, look, the Human Rights Committee told you to improve your procedures for arrest under protests. So please do something about it. So it's a way for you to write your report, receive the recommendations, and internalize the recommendations in the country. Just to give some examples, Denmark has an NMIRF that is heavily criticized because it only writes the reports. So the Danish NMIRF writes the reports, sends it to Geneva. My work here is done. So there is no way of incorporating these recommendations, whereas the Portuguese one, a Comissão Nacional de Direitos Humanos of Portugal, they work interdisciplinary on writing the reports, discussing the recommendations, and seeing who is going to implement it. So there is work being done for Guinea-Bissau to have it as well. And there is a human rights mandate within the National Assembly. So the first specialized committee is supposed to work with human rights. So these are all very good things for working with human rights in Guinea-Bissau. However, in the last 5 years, the parliament has been dissolved twice. So you haven't had a government of parliamentary initiative since December 23. There is no real human rights architecture. So there is a Human Rights Commission, but it's not really independent. It sits under the Ministry of Justice. The president, a national human rights institution, should be the watchdog of the state. So should be the institution that is a state institution, but can say, government, this is wrong. You're not doing this correctly. So for example, when you have an international procedure within the UN, the national human rights institution should not be representing the state and should be saying, hey, state C, I told you to change this. I told this legislation was not good. And this recommendation, we are going to work now to implement it. That's the role of an NHRI. The president of the National Human Rights Commission of Guinea-Bissau has been part of the Guinea-Bissau delegation, both for the Universal Periodic Review, which is an international process, and to the evaluation of Guinea-Bissau in the Human Rights Committee. So the fact that the president is there shows the lack of independence of the institution. She could not be part of the state delegation. The DMRF is an aspiration, it's not there yet. There is no real human rights capacity within the Ministry of Justice. And here you see how complicated it is, because the Minister of Justice right now, she knows very little about human rights. So she uses the Human Rights Commission that should be independent as her human rights department. So everything is mixed together. The democratic space is shrinking. So you have press being prosecuted, press being expelled from the country. You have activists being searched, houses of activists being searched all the time. So people feel they can talk less and less. You really see the problems of implementation of economic, social, and cultural rights. So education, health, social security, these rights are not being implemented. And you have severe, and then the challenges with education and health, which are extreme. So for example, if you look on the, I'm very bad with data and graphs, but people more intelligent than me have done this. And they've shown that if you correct for inflation, the actual amount of money invested in the education sector has diminished in the last years. Guinea-Bissau has one of the lowest ratios of children that end school in the correct age. So a lot of children don't finish school by the correct age because they repeat, because they leave, because when they come back, they're not able to continue in that class. And most of you know the challenges of the health sector. And then here, whereas you see like 1 step forward, 2 steps back, sometimes on the shrinking of the democratic space, the lack of data in Bissau is really impressive. It's difficult to find, it's difficult to search. So last year, yes, in April last year, the network of human rights defenders of Guinea-Bissau published this paper called A Favorable and Safe Environment to Defend Human Rights in Guinea-Bissau, what it's the first time civil society actually develops a methodology to look into data, to see how many people have been arrested, how many people have been prosecuted, how many of them are women, how many of them are men, and have published this document showing the issues with the democratic space in Guinea-Bissau. And it shows that the democratic space is shrinking and that the law is there. So we don't need to change much in the legislation. There is need to change, but freedom of expression is there. Freedom of association is there. But what we need to change is the implementation, how these laws and regulations are implemented in the country. What about access to justice? There are not sufficient courts in the country. Most cities and provinces don't have a court. Where it exists, it's falling apart. Sometimes there are no judges there. There are funny anecdotes with UNDP, and it's my former employer. I shouldn't be talking bad about them, but still funny, tragicomic. So UNDP built a court in Boubaké. So several million shaf built the court. I'm not sure if they equipped it, but it was there. Nice building in Boubaké, Tribunal de Justiça. Let's go there. The Ministry of Justice is incapable of finding judges to actually be in Boubaké. So a few years go by, 2 or 3, no judges, still the same problem. Now you have the court, but you don't have the judge. Finally, they find the judges to go to Boubaké and sit there in that court and start judging from there. And then the roof falls after the rains. And the Minister of Justice has no money to fix it, so they have to ask for UNDP for help again. And UNDP pays for putting the roof again, and then there goes 2 more years without the court functioning. Because now the judges could be there, but there is no building. So this happens a lot. Boubaké is anecdotal because it shows what happens in the country. And because, has everybody here been to Guinea-Bissau? Yeah, no, the roads are awful. The roads are awful. So if you leave the center, you have to go to the countryside. It's a trip that would take 2 hours in Europe, will take 4 or 6, depending on how heavy the rains had been falling. So a lot of judges, they don't want to go to the countryside because their families are in Bissau, their children are in Bissau. Why am I going to do that? So the whole infrastructure is a challenge. State fragility and lack of strong institutions. The judiciary is not known for being independent. The few cases of prosecution of the big fish, so big drug traffickers or some politicians, they did not result in a fair trial, or when they did, with a sentence to the person being arrested. A few days later, the person was walking by in the streets of Bissau because there was no real prison in the country. There is no real, when you have a case involving big personalities, when it comes to the Supreme Court, it will be probably decided in favor of this person because the judiciary is unfortunately not independent. There is a common use and long-standing of well-established traditional justice mechanisms, which is not necessarily a bad thing, but traditional justice is not part of the legal system, the constitutional legal system of the country. So you have 2 parallel systems running in the country. You have the constitutional, legal, civil code, criminal code, and then you have several traditional systems for each ethnic group, for each tabanca. The regulo of one tabanca will decide something, the regulo of the other tabanca will decide something else with the same kind of case. In many of these traditional systems, you have a tendency to discriminate against women. So usually cases are decided in favor of men, especially in cases of violence against women. Women get beaten, women get sexually assaulted, and it's usually please forgive him, it's just marriage, go back to your house, kind of decision. So you have, these practices are very common in the country. And there is insufficient funding for the justice system, which happens for a lot of other sectors of the country, and I already mentioned independence. Amelia, I know I talked a lot about women's rights last night, I'll keep talking about it. So this is from a study that was conducted in 2023 called Auditoria de Gênero. It's a gender auditing of the justice sector in Guinea-Bissau. And it shows the amount of men and women in decision-making positions within the justice system. So as you can see, there are only 5 women. The M, for those who don't speak Portuguese, is mulher, and homem is male. So it's not only that women don't have a say, they're not represented in the justice system either. So you don't have women in strong positions within the justice system. The country lacks a specific strategy for gender equality. Most countries either have done it at some point or I don't know if Denmark has it now, but I'm sure it has had it because it's important to see like how are decisions being made? Are they affecting women and men differently? How are they affecting women and men differently? So these usually exist in most countries. There is no integration of international norms on gender equality and women's empowerment within the justice system. The CEDAW, this Convention on the Elimination of All Forms of Discrimination Against Women, brings a lot of rules and methods of what you have to do as a state to promote women's rights and empowerment, and these are not seen within the justice system in Guinea-Bissau. There are no women in decision-making positions, and there is no office or unit talking about women's empowerment and rights. And you'd say, like, why is this important? It's because it is a country that suffers a lot with gender-based violence. Women do not participate in public life. They are not, with the last election in June 23, the number of women within the National Assembly diminished instead of increasing. Even though the parity law was approved in 2019, the number of women within the legislative of the country has decreased in the last years. Gender-based violence is rampant. So you have domestic abuse, you have sexual violence, you have FGM, female genital mutilation, you have forced marriage, and there is a lot of human trafficking. Impunity, as I mentioned before, in traditional systems prevails, and Guinea-Bissau ranks 174th on the Gender Inequality Index, reflecting women's systematic marginalization in education, healthcare, justice, employment. And that's because a lot of them are illiterate, and there is still, patriarchy is well and alive everywhere, but it's quite strong in Guinea-Bissau. And what has been Guinea-Bissau's attempt to change some of these realities? Because you have the problem of the justice sector being poor, you have the problem of not having sufficient courts. So in 2010, Decree Law number 11 was approved with a general framework of legal assistance. So now from 2010, there is this idea of working for the poor to having access to justice. And then in 2011, a new decree was approved and established the Office for Legal Information and Consultation with a jurisdiction across the national territory and through the Centers of Access to Justice, or CAJ. And here, I think, I've talked bad about UNDP, now I'm going to talk well about UNDP. This is, for me, one of the experiments that has worked. The CAJs, they were 100% funded by UNDP back in 2012. So the rental of the places where the CAJ was functioning, the equipment that was bought, computers and printers, cars, the fuel for the cars, the fuel for the generators, the salary of the staff working for the CAJ, everything was paid by UNDP through one of its, I don't know if it was rule of law or judicial reform, access to justice projects. What they did is, okay, we've paid for this. We know you still don't have time, but no, we're going to stop. We're not paying for this forever. So UNDP slowly stopped paying for different things. The state took over the salaries. So every CAJ employee today is paid, and it's paid by the state. In a lot of places, the fuel for the generators was replaced by solar panels. So now there is no need to buy fuel from UNDP anymore, for UNDP anymore. A lot of the rentals were either made into buying the property or the state getting a place that was already owned by the state. So now a lot of the CAJs are within state buildings. And there is an idea from the CAJ itself to become a public defense office, where public defense will be given for free for the population by a state institution, which is not very common, I think, in your jurisdictions either. Legal aid is usually not a state obligation. There are only a few countries in the world, in Latin America, that do that. So this is from a report from the CAJ, and I put it first because I don't think it's the most important, but it's the first thing they put there. So absence of dedicated transport. So because each CAJ is in the center of the region, they can't really go to the most remote areas. The capacity of the technical staff is still weak. The CAJ is not independent. So where public defense works in countries, it's usually an independent office that can actually prosecute the state for violating a right. The law right now, Decree 11 of 2011, does not allow for the CAJ to provide legal aid directly. A lot of the population don't know about the CAJ yet. They lack resources, and the large majority of the staff is male. And why is this an issue? Because you say, oh, but that's not an issue. It's because a lot of the cases in Guinea-Bissau concern women's rights and women's access to property and violence against women. And loads of studies have been conducted showing that women who are victims and survivors of violence prefer to talk to a woman than to a man about her case. When you don't have women in any position, you don't have women police officers, don't have women in the CAJ, these cases don't even get reported. So some of the successful experiences of the CAJ is working on mediation and conciliation. So instead of going to the regular justice system, you work with what the population already knows. So you mediate a conflict, you try to reconcile people. Use traditional justice methods. So the CAJ interacts with the reculus, with the chefs de tabancas to see what's happening there and to provide the decisions in accordance with that community's rules and procedures, but using a human rights perspective and a human rights lens. Links with CSOs that already work with this. So you have, for example, Voz de Paz, you have, I won't remember Voz de Paz now, but you have local national NGOs that work on this. So what it's been tried to be done is to connect the CAJ, the national CSO that already works with this, and the chef de tabanca, the regulo, so the decisions can be made according to the procedures of that community, but following international human rights law. South-South cooperation has been quite successful. So in November 24, the Minister of Justice signed an agreement with the Brazilian Public Defense Office, where public defenders from Brazil come to Guinea-Bissau to support them, the CAJ, on thinking about how can we make this decision different? How can we use this population to advocate for their rights? And the focus on women. And what are the opportunities we have right now for improving access to justice and rights in Guinea-Bissau? So we have a constitutional reform process going on. Inshallah, in November, we'll have a new National Assembly. We'll have new MPs, inshallah, with 33% women. And then there is a constitutional text ready to be voted. Like the draft is there, it's ready to be voted. Maybe it will be voted. Maybe there will be some opportunities to discuss a few articles to include some new institutions or rights. There is an opportunity to work with extrajudicial decisions. So everything you can satisfy people's demands for rights without involving the judiciary, and work broadly on access to justice with legal guidance, legal information, legal consultation, legal aid when necessary, and access to courts using strategic litigation, which is a tool that I haven't seen used in Guinea-Bissau yet. So I stop here because I think we don't have time anymore. And thank you.
Thank you, Camilla. That was super interesting. I think in the interest of coffee and time, I will defer questions to the coffee break. So we'll break now for coffee, and just to capture a bit of our delay, I ask you to come back 11:10. Thank you.
Great. Thanks very much, Søren, and it's lovely to be here and hopefully to make new friends. Well, let's see. I just want to share with you some fruits of my experiences working in what used to be called development studies over the years. I'll start, well, let's see. Let me go back. So I'll introduce myself a little bit and why I might be here. Talk a little bit about the experiences drawn from different phases of my experiences working in, as I say, what is called development work over the last 40 years. And these are sort of different eras there. I have experience working in Africa for a long time. It's kind of shocking when I look at it that my first time I went to Africa was in 1970, before most of you were born, I guess. My experience in Dahomey, what was then called Dahomey, now called Benn, was kind of life-shaking, world-changing for me. It was a very dramatic experience. It's important to remember in 1970, that was 10 years on from the end of the formal period of colonization by the French, and then moving on to the period of neocolonialization that followed thereon. I worked then, as Søren said, in Damagaram. I don't know why, I forgot why the French called it Zender now, but it was properly called Damagaram in eastern Niger for quite a number of years. Got a PhD in economic anthropology in '83, and then worked in development stuff in all over Francophone West Africa, also some in Anglophone Africa thereafter, and then did some work later on in a little bit in Kenya and Uganda. So seen a lot of things, been involved with a lot of different projects. So back in the 1980s, social scientists like me, anthropologists, were brought into development projects because it turned out that the economists weren't all that good at extracting value from West Africa, and they needed more social scientists to figure out how to do that. And so they brought anthropologists in to do that kind of thing. Kind of the rubric under which we anthropologists were brought into to work was kind of under the idea of social impact evaluation. So there were natural scientists involved and doctors and things like that, and then the anthropologists to do social impact evaluations. So some of the things we worked on were things like fisheries projects. This was on the Niger River, trying to deal with fisheries issues there. There were also what were called integrated rural development projects, which were largely based around trying to intervene in the agricultural sector in Niger. And then also, interestingly enough, a project in the healthcare sector. And I was very interested to hear this session this morning talking about problems of data collection and data quality. And indeed, these projects way back in the 1980s in Niger with the Ministry of Health was about trying to normalize and regularize and collect and computerize healthcare data. So I learned a lot from these projects. And one of the things that I learned is that top-down interventions do more harm than good. Another thing I learned from these projects is that a lot of the things that happen in development projects, and I heard this today, again, from more recent interventions, is that there's a lot of competing interests in the world of development, where personal ambitions, institutional priorities sort of intersect and result in sort of conflicting outcomes. Another thing that I think I took away from this, working with the Sorko fishermen or working in villages on agricultural projects or working with the health ministry on health projects, is that there are existing, this is always news to the international development people and to the economists, there are actually local institutions that deal with issues of agriculture or healthcare or fisheries, where people actually know something about what's going on the ground. This was always news to the World Bank. Also that local folks are highly able to adapt to external pressures and are quite clever at doing so. Another thing that was an issue at the time, particularly with the healthcare sector, there was the belief that rural people wouldn't pay for healthcare services, and so they had to be given for free. And data that that was collected at the time showed that this was not, in fact, true. In fact, people paid a lot for healthcare interventions, but they often turned to so-called traditional healers and traditional sources of intervention, everything from native medical practitioners to the Islamic marabouts who were providing spiritual guidance, and people paid a lot for these services. They weren't really willing to pay very much to the Ministry of Health because they thought that the Ministry of Health didn't provide much value. So it was really an assessment of bad value that people weren't willing to pay for. But there were other things, that is that when there are major shocks to the system, colonization being one of the more important ones, but other kinds of shocks, such as the major climatic changes. When I first started working in Africa, there was sort of the major drought that occurred in the early 1970s, where there was a massive shift in annual rainfall figures all across Africa, and that change occurred and then continued. And so that kind of major catastrophic change is difficult for local folks to deal with. Another thing I learned from working in this social impact evaluation is that it was very important for foreigners, such as myself, to develop a more self-critical, more self-reflexive attitude towards local situations and local institutions. That is, becoming a humble and lifetime learner rather than a dispenser of knowledge was an important thing an important role to take on in order to be effective. Also, that social science data could be an important and powerful tool in trying to implement positive social change. So, for example, in each of these projects, that fisheries projects or the integrated rural development projects or the healthcare projects, social science data was powerful. So, for example, these integrated rural development projects that the World Bank, that the UN, that the European Union, and that US Agency for International Development had undertaken would produce these evaluation reports on a regular basis about all of the wonderful things that they were doing, how many farmers had adopted improved seeds or improved technologies, and how many farmers had been trained to do this X, Y, or Z, or how many people had received literacy training and so forth. And so there were all these wonderful evaluations of the positive effects of these projects. So we at the Ministry of Plan undertook independent evaluations of these three big multi-million euro projects in different regions of the country, and found that the net effect, at least from the data that we collected, the net effect of these projects on local livelihoods and practices and so forth was 0. This made us extremely unpopular with the European Union folks, the World Bank and USAID, but extremely popular with the national bureaucrats who had the suspicion that this was a bunch of baloney. These projects were useless. And so we're able, in negotiations between the Ministry of Agriculture and the Ministry of Plan, to decide on policies such that these giant projects would no longer be acceptable, and instead there was a turn towards local projects and local funding, particularly foregrounding the work of NGOs who seemed to be more effective in delivering actual value to people. So the social science data in this case was actually effective in doing something positive. So from my experience in the 1980s, I kind of came away with the idea that foreign intervention or development projects in general, and the best you can kind of hope for is doing less harm than good. And usually it's 1 step forward, 2 steps forward and 1 step back in these kinds of things. Later on, I got involved a lot more with natural resource management issues and things having to do with cultural ecology and environmental issues. And we did a large study across 4 countries in West Africa of interventions in natural resources management that could be characterized as successful. And we came up with criteria to define what successful meant in terms of these kinds of initiatives, in terms sort of longevity, self-sustainability, delivery of actual benefits to people and things like that. But one illustration from much later in time, but something that we talked about and just learned about in this 4-country survey of project initiatives was farmer-managed natural resources. So those are pictures of Acacia albida trees. And Acacia albida has the wonderful quality of losing its leaves during the rainy season and putting its leaves out in the dry season. It also is a nitrogen-fixing tree so that it has an incredibly positive effect on soil's health. During the colonial period, when there was an emphasis on trying to increase agricultural productivity at all costs, and the sort of French and British experts told the farmers to cut down all the trees in order to increase their yields. Of course, people cut down all the trees, and of course, what happened is all the soil blew away naturally. And so, for some of these interventions, then in the 90s and 2000s, were involved with recapturing local understanding of the usefulness of native tree species, so that the sort of punitive approach to forestry was relaxed, and people were able to do things like hold on to value-producing trees like the Acacia albida and other examples like that. In any case, things that we learned from looking at successful examples of resource interventions was the importance of providing support to local organizations such as the CAFO, which is something that we found in the Gambia local sort of cooperative organizations. So I was very interested in hearing our colleague talk about the traditional systems of judicial systems in Guinea-Bissau, that made me really perk up my ears because I thought, aha, here's where actual intervention that would be meaningful in the justice system could take place, rather than trying to impose sort of international standards of justice with judges and lawyers and so forth and so on. Why not reinforce local systems of judicial management? Anyway, another thing we learned from natural resources management is that people are already doing things to try to respond to changes in the environment, like moving germplasm from place to place. So sort of the assumption of Western agronomists is that local people don't know anything about agronomy and they need to learn from the West. Instead, you discover that people actually do know a lot about agronomy and do things to try to mitigate the problems that are associated with climate change. Another thing that we learned from this is investments. So again, the FMNR example here, investments in the resource base, that is, rather than investing in things like micro enterprises, which is a useless thing to do, it's more important to invest in the resource base, which then provides the basis for sustainable, perhaps micro enterprises. Another thing we learned about from these successful case studies in terms of intervening in local systems is that in order for interventions to make sense, you have to think about payoffs to various stakeholders in the short, medium, and long term. Those projects that succeed have to show benefits to people quickly in order for people to get buy-in. But there also has to be buy-in. There also have to be benefits over time. Another thing we learned about this is one of the reasons that projects fail. This is one of the things that happened to the fisheries project that I spoke about in Niger earlier. One of the reasons projects fail is that there's an inattention to the existing pattern of resource circulation, resource flows, and stakeholder benefits. So who is benefiting from the current system? If somebody is benefiting in the current system, changes to the current system have to take into account the costs and benefits to those stakeholders so that powerful stakeholders don't feel threatened by the loss of resources through institutional change. This is typically, at least in my experience in West Africa, you have to pay attention to the customs officials, you have to pay attention to the police, to the gendarmes, to other kinds of low-level local authorities who may be put at risk, their livelihoods may be put at risk through well-meaning interventions by outside actors. So you have to think about how to manage those things to avoid institutional pushback. Another thing that we learned from this is that when there are really crisis situations, when there are really catastrophic problems, such as I worked in Chad during its periods of incredible civil unrest and civil war and so forth. When there's absolute catastrophic change like that, then thinking about long-term resource management is not. It has to go off the table, and other things have to come into focus. Another thing learned from these lessons is that although there can be incredible local knowledge embedded in resource management, things like that, when the state goals are imposed from above, this can swamp and overwhelm local communities' ability to adapt and respond to crises that they face. Another thing I think we learned from looking at a lot of interventions in the natural resource system over time, and I think it's very important particularly for people sort of beginning to work in development kind of issues in places that they're not familiar with, that many institutional actors are not well-intentioned. If you come from someplace like Denmark or where I live in Finland, you kind of assume that state actors are well-intentioned. That is a very bad assumption to bring with you into the field in many places. it's much wiser to start with the opposite assumption. And I think a lot of people who don't have experience working in development and so forth don't appreciate that enough. And that means social science is very important because trying to figure out what the ill-intentioned actors are up to, how they operate, and why they operate as they do is perhaps as important as anything else, any technical or scientific issues that you're trying to wrestle with. So it's kind of an extra added sort of burden of knowledge on those trying to intervene in systems, is to appreciate local systems of resource extraction. So of course, the tides of development policy change, they're constantly changing. So we did all this wonderful work on natural resource management in the 1990s. And of course, governments change and priorities change, and World Bank suddenly decided, the solution to development in Africa is market interventions. So we need to liberalize the economies and engage in microfinance and all kinds of things like that. Okay, great. So I did a bunch of work on looking at market interventions. One of the coolest projects we worked on was a cool project on onion marketing in the Niger Republic. And onions were, you could see the onions there at the top of the slide. Traditional crop, highly embedded in the local economy. Local folks knew how to trade, employing all kinds of markets, institutions that were historically embedded in market trade in West Africa since forever. And what we were trying to do there is just figure out how to sort of optimize the onion trade. And in that work, it was the accommodation of state institutions became really critical, because the onions grow in Niger, and then they're exported to all of the coastal countries. So Ghana, Togo, Benin, Nigeria, Cote d'Ivoire. And of course, when you're crossing national borders in West Africa, okay, so the phytosanitary officials, the customs officials, the gendarmes, the police, and so forth, everybody's taking a cut. And so you have to figure out how to manage that, because that was clearly the biggest problem. The biggest problem was not how to grow or how to market onions. The problem was how to deal with the institutional constraints to a more fluid trade system. And lo and behold, actually managed to do something about that. One of the ways we did that was we rode on the onion trucks from the point of production to the point of sale, and found all of the blockages in the system, and talked then with institutional authorities about how to deal with those. Did a big project on fair trade. This was not in Africa. Fair trade is something that operates all over the globe. One of the things that I think we did a very sophisticated statistical analysis of comparison of participating cooperatives and non-participating cooperatives in 3 countries in Latin America. And what we found is that the fair trade model improves incomes marginally, positively, but marginally, because the kind of crops that fair trade is interested in, cocoa, coffee, and so on and so forth, are only a small part of most smallholders' portfolio of economic activities. So, okay, fine. What we also found that was more interesting was that participation in this cooperative movement actually had a more positive effect on well-being and ideas about the future than the actual economic benefit of participating in fair trade. This was not sort of, but in the end, I think we concluded, although we didn't write this in our reports because we were polite, is that fair trade is basically a kind of virtue signaling, and that's about all it is. Some people are even more critical than that, and I think correctly so. I also did some work on sort of microfinance, base of the pyramid, BOP, base of the pyramid, microfinance work in Africa, because this was all sort of part of this neoliberalization move. And there are just fatal flaws in the logic of microfinance. Because of this sort of intractable legacy of extractive economics, the sort of colonial approach to Africa, whether it's in agriculture or mining or so forth. These structures and institutions are so ingrained and so powerful and so outside of local control that it's very difficult to intervene effectively with these tiny little external infusions of finance capital. On the other hand, the digital banking, which is sort of accessory to microfinance, is actually quite revolutionary, and there is enormous scope for positive development. So let me quickly wrap up here. I think it's really important when you have not worked for a long time in Africa or any place else for that matter. So I was really happy to hear the first presentation today where there was a clear evidence of a long-term commitment to understanding a particular set of problems. And our colleague, Peter, at the end said there were still mysteries and things that were not understood after more than 40 years of work. I think it's really important to enter into work in institutional contexts and cultural contexts that we're not familiar with deep humility about the situation we're entering into. And it's really important to learn as much as one possibly can about the historical and institutional context that one enters into. At least that in my experience, in all the work I always did, I always have tried to read the history to try to understand as a baseline. I also think another thing is that there are always local organizations of some kind. There are always local ways of managing and doing things. Rather than sort of imposing new ones, it's always more useful to try to figure out what the local organizations are or were, because sometimes they've been crushed by colonialism and other things, but there's always a substrate there. I have a picture here of the Foni Joral Gambia Cashew Farming Cooperative. And I was interested to see this. Whatever the merits of the particular cashew farming initiative may be, we, back in the 1990s, we worked in this community, and they were already working on things like salt intrusion dams because of climate change affecting the rice cultivation in this region, already working through local organizations to try to confront the problem of climate change and the effects on the rice cultivation. So when I see that in 2025, that there's some kind of more activity going on in that community, that tells me that there is an institutional basis for action that's appreciated locally and incredibly valuable. I think that, I also think that when one is not a local person, one has some kind of technical or scientific expertise, that can be valuable and it can be valued, but it's always important to engage in participatory work in the field, not to sit in an office, as Peter was saying, not to sit in the university, but to work in the field and spend a lot of time in the field with local folks, thinking about what's going on and adopting a service orientation towards so-called development work. That is, you actually are not really an expert in the local situation, no matter how much engineering or scientific knowledge you may have. You're not an expert. You need to learn rather than teach. in my opinion. And sets up a virtuous cycle that can actually produce positive change. I think that I kind of had to give up on working in the development sector, because I just was constantly confronted with the fact that all of these wonderful local initiatives by NGOs and well-meaning people always confront the reality of power. And that reality of institutional power constantly thwarts the efforts of people to do well. It's also important to remember that even when we're involved in institution building, there's always a class interest. There are class interests at stake. And that those class interests are not always favorable to people who we might like to be providing benefits for. Development is always, and unfortunately still is, always carried out under a paradigm that local population should somehow conform to the international order. So I was a little bit sad in the presentation on the legal system to hear the same sort of thing. Oh, here we have all these international conventions, the UN, so on and so forth. Here's what people in Guinea-Bissau should do because this is what the international order says should be done. Yeah, maybe, but I'm skeptical. I'm not a big fan of this sort of imposition because it never seems to actually work out to benefit local people. And it really seems, in the end, it seems to me that so much development work just boils down in the end to how to extract more value from rural labor, how to extract more value from local natural resources. And, and the development stuff just kind of puts a Band-Aid on the worst problems in order to continue to figure out how to extract more value from local folks. At least that's been the paradigm since the late 19th century when the Europeans decided to really colonize Africa. I'm not sure much has really changed in the century and a half since then. So that's my negative take on that. So there's lots of things that one can learn from doing development work. One can do good work, but they're always under constraint. So I've just tried to share a little bit of my perspective on all this stuff. This is all written up in publications. If you want to see those, you're welcome to. I'm happy to share those with you, but that's what I have for you today. So thank you very much.
As you were presented, my name is Morto Fande from Amílcar Cabral University in Bissau. My presentation, you can see the titles. This is part of my research in the northern of Guinea-Bissau. So I'm going to talk small about the coastal community perception on climate change and climate change impacts and adaptation. Here in the first part, as you see the title, the focus of this work is on climate change, but we focus more in sea level rise. That is sea level rise is one of the most significant threats resulting from global warming. And as is known, poor rural communities in low developing countries are most vulnerable to climate change. And in Guinea-Bissau, Guinea-Bissau is a coastal country with a low-lying coastal area. And it's most of the rural community about around 60% of the rural population live within 10 kilometers of the coastline from the sea to interior. And these people are vulnerable to, susceptible to the impact of sea level rise. The objective of the study is to investigate perception of coastal communities in Susanna sections, northern Guinea-Bissau, regarding sea level rise and climate change, their impacts as well as the strategies used to cope with the phenomena. The study area, as I said, Susanna is a section, administrative area in the northern of Guinea-Bissau. Is the third level of division, administrative division. We have region, and then sector, and then section. And it is located in the northern of Guinea-Bissau and limited by the Atlantic Ocean. You can see here in the map is this area. This is Atlantic Ocean. You can see also here. The region is characterized is a low-lying lands, wooded and grassy savanna, mangrove ecosystems, water bodies like rivers, swamps, lakes, etc. And it has beaches and dunes. So also Bologna, this one is, we call Bologna farmland, exposed to inundation that people use to produce rice, normally in Guinea-Bissau. We call it Bologna. Here, my option is to use the land, but this land susceptible to inundation, where people use to plant rice. And it have a residential area, but is a rural area. The population in this area is around 6,700. The last census was in 2009, so many years ago. I think they are going to do it this year again. We have in this region, we have mainly an ethnic group called Fløistrup or Diola in this area. As you know, Guinea-Bissau have many ethnic groups. In this area, the main group is Diola. Recent studies show that the region is severely affected by coastal erosion and inundation. This was, as you can see, next verse. This is my part of my works. Here is some of my work in this area. For you to know, I'm not a social scientist. I'm not from social science. I'm from environmental engineering field. But after this work, I thought that is important to, after this work here is I map coastal region in this region. You can see that in this point, for example, we lost land here around 18 meters per year in this part here. But we have also accretion in some part of the coast, like Like here, no, here, for example, here, we have a question here. Here, this part, and we have a erosion in some part. But here is around 18 meter we lost of land we lost per year through erosions. So you can see the beach in Varela in Susanna regions. So here is my other work that shows that the region also is vulnerable to coastal flooding or coastal inundation. You can see here. Here we map coastal inundation in different scenarios of sea level rise. Till present, 2041 till 2100 with different scenario of sea level. You can see the different color as the sea level rise. So different parts will be affected by sea level. So this is part of my work. After this, I thought that is important to go to hear about the people living in this place, how they understand what is happening in the coastal zone. So that's why this work that is not in my field, but I think it's important to understand how people, what people understand and think about coastal erosion and inundation in this area, people living there. So in these works, this study, we do this study in 14 villages close to the coastal area. These people who have their life is related to the sea. So we work with communities from the 14 villages, and contact with these communities were facilitated by a local community association that's called AUFAS. So we invite the residents, men and women, for an open meeting to hear what they think, what they know about climate change and sea level rise. The meeting was held in 10 villages. Some of the villages were, we grouped some of the villages that are close each other. So that's why we had 10 meetings with them. Here you can see image meeting here in Stabell, here in a village called Aaby, and here in this is Elalap here. So Stabell is a island. And during the meeting, we have a volunteer who help us to translate, because, for example, old people don't speak very well Creole, only Fløistrup. So a volunteer help us who speak Creole, and Fløistrup help us to translate. And we record the meeting, and we get also notes. We took notes of the meetings. And then we do thematic analysis, organizing the interventions by their similarity. And then we code the village. We code the village and the intervention. And here is just an illustration, because there was 10 villages. Here we put only 4 to see how we code, the coding was. Like the name of the two first letter of the name of the village, plus the intervenient here, the intervenient in each village. And the result is here. Here we maintain the result here in first person, how they express their self in first person. First part of the result was about the perception of sea level rise. We can see that the community have a clear perception of sea level rise through the expression we have here. For example, in this village, the intervenient for number 4, he said, the seawater is advancing. And here we have, the seawater is rising every day. We don't know if white people are burning the sea in other area, and that is why it's rising here. If some people in other area putting something, filling the ocean or the river, and the water is going to there. Other here said, the sea is advancing over the lands. In fact, the sea is not as it was before. It has advanced. So so the people, for them, the sea is raising. This perception of communities is going in the same line with data from tide gauge and from satellite altimetry measurements, because this saw that in our regions, West Africa, the sea level is rising, and the population have the same understanding. And this part perceives impacts of sea level rise. We can see that the community associate the impact of sea level rise with the inundation, erosion, salinization, and loss and alteration of ecosystems. Impacts related to inundation. For example, here the intervention number 3 in LLAP say, our important Bulanya are inundated and degraded. Nowadays, we cannot organize traditional celebration to bring together people, such as traditional wrestling. We can see that the impact of sea level rise is affecting the culture. Because they don't produce a lot of rice because of the inundation. So now they cannot organize traditional wrestling because these traditional celebrations put a lot of people together, and you have to have resource to support the food people will eat, etc. So now they cannot do it because it put all village together, and to organize it, you have to have food and other means to organize it. So it's affecting their culture. Oh, she's not. Here, some of they said, here, in my house, the water reached the porch. We have not moved yet, but we will have to move because water is coming till the porch. So they will have to move. Another one said, we used to produce a lot of rice in our Bolanya, and we left the other part to the village of Jifung. But ours was damaged, and we had to move to the other one, which is causing problem with the people from Jifungu. They have their Bolanya, but now the Bolanya is damaged. Before that, the other part of the Bolanya is was used. People from other village used the other part. But now, as this one is damaged, they have to go to work together in the same Bolanya. And this is causing conflicts with the other village. So that one of the creating conflict because between the villages, because they now have to farm in the same Bolanya because the other one is damaged. Here, he said, now you can build a very high dike, but the water will still get into the crop field. If you plant, you are not sure if you will. You are not sure if you will harvest, because storm can come and will inundate all the area, and you will not harvest anything. So in the past, when they farm, they know that they will harvest, but now they can't farm. They are not sure because of flooding or inundation. So this is other part. The dike, here you can see the dike they used to protect the farmland for the sea, the water to not get into the seawater to not get into the land, the farmland. So they built this one. This is the traditional, and this is the modern one, where they can use wood and maybe some machine with support of NGOs or with support of projects of government. They can build this. But this is traditional that the community build by themselves. It's more simple. They said that now they don't produce enough rice to sustain the family. You can produce rice for just like maybe 3 months, and you don't have more. You have to try how you will get rice to buy or anything, because what you produce is not enough. You can see here, somebody said, if you tell me that when I die, my son will inherit my house, I would say that is a lie. Because this was in Stabell, the small island, because the water come over all the village. So they don't expect, they think that in the future, their son will not live there. Many people do not come in these meetings because the tide is coming and they are afraid to leave their children alone because the water is around. As you can see here in Stabell, you see here you have the houses and the water is around. So they said it was like that when we were in the meeting, and they said some people didn't come to meeting because they cannot leave the children alone at home, because the situation is that if the children they build that around the house, But you have to have somebody adult in the house. You cannot leave children there alone, because if they try to move or to swim, something bad can happen. So some of them didn't go to the meeting because of that situation. Somebody have to stay at home. Impact related to erosion. They said this was in LLab. They said coastal erosion is clearly visible. They said you can go just around. You will see is one of the threat the problem they are facing. And here he said the sea is eroding land. Before, we used to walk 7 kilometers to reach the water or the sea. But now it is not even 1 kilometer. So that means they perceive the coastal erosion in this area because the sea was far, but now is close to the house. And other one said, the sea took many lands, fruit plants, so they are perceiving that erosion, for example, is destroying coastal area and many plants that produce fruits they use to eat, and they are losing these fruits because of the erosion is destroying the coastal area with the plants. The beach profile has changed. Before, it was about 20 meters wide from land to water, but now it's not large, it's small. One say, the water destroyed hotel complex. You can see here, there was a hotel complex in Varela that was destroyed. Some of them say that this was around 500 to the meter to the sea, and that it was built in the decades, I think it's 1980, but now you cannot find nothing there. It's totally destroyed by coastal erosion. It was a big complex. Once we feel the problem, our children will not live in Varela. There was white sand in the beach, but not anymore. They think that in the future, the Varela will not exist. It will disappear because of erosion. All the village called Varela will disappear. One said we worked, okay, yeah, I was saying. He said we worked on the Italian project, the complex, the hotel complex. It was the Italian project. Okay, and he said, yeah, the sea was about 500 meters from the hotel. But now the hotel does disappear. That was in Varela, the village in the section, the coastal section there where there is erosion. Impact related to the salinization. One said, articular works carried out by women is now affected by soil salinization. And in another village, somebody say, our drinking water has changed. It has become salty. It becomes salty. The sea has damaged the Bologna, and now salt crystals are appearing along the dikes. So here is affecting water, is affecting also agriculture because of the salt crystal that appear in Bolaños. And somebody said here that this crystal bent the rice. If you put rice there, it can't grow well. It's like the salt bent bear the rice. We dig well at our house, but in the mouth will be salt. We can dig your wells, but it will become salt. And here, impact related to loss and alteration of ecosystems. One of them say, this was in a village called Catan. He said, we lost trees with many functions. We lost lost traditional medicine from plants, food, etc. So they understand that they are losing, because of erosion, they are losing many plants, medicinal plants they use for traditional medicine. Many plants they use for traditional medicine, also for food. Also, he said coastal erosion destroyed the mangrove that protect the fish. So this also is impact. You can see here, they understand that erosion is destroying mangrove, and mangrove is where the fish live, where the fish live and grow. And other one said, the advance of the sea has wiped out the, I don't know where the producer is cocks that were in abundance. So they are losing food because of erosion. Because of the ecosystems, alteration of ecosystems. The tree palm has gone. The mangrove where we had oysters has disappeared. Because of the erosion, they are losing many palm trees in coastal area. And losing also mangrove where they can have oysters. Adaptation. We can see that the coastal community are practicing many adaptation strategies to cope with the situation. For example, they said that they usually produce in a field, rice fields, but now they move to the other one. As that one is damaged, the adaptation is to move to use another field for the production. Also, he said, we used to live mostly off agriculture, and now we live more of fisheries resource. So they are changing their life. They used to eat rice, but now they cannot produce enough rice. They are changing the activities. They are changing activities. And here, the salt water took over the Bolaña. So we start farming in the sandy area. They change to the sandy area. Okay. And here also we can see that they normally farm rice, but they are practicing now horticulture because they cannot produce enough rice. They have to do other activities. They also say here that they use anti-salt dike, okay, to cope with the situation, to maintain the branya, to continue to use it. They built anti-salt dikes. Here also we can see that they have, some of them say that they have changed their activity, leaving the branya and going to the forest area to cultivate in forest area. So that will result in degradation of forest, because branya is more productive than the forest area. When you farm the branya, you can harvest more rice, but in the forest area, the production is not good, but you will just destroy the forest. Last year, inundation caused difficulty. So we have to move the cows to another location. That was in Stabell Highland. As all the island was inundated, they have to move the cows to another village because they cannot stay there. This as a conclusion, we can see that the population in this area have clear perception of sea level rise, and they have been developing different strategies to cope with the impacts of sea level rise. Perceived impacts includes damage to agriculture, housing, infrastructure, water resources, loss of ecosystem service, mainly related to the phenomena of inundation, erosion, salinization loss, and alteration of ecosystems. It's come clear that Stabell Islands is the village most affected, particularly by coastal inundation. Because this area is a low-lying area, so it's the most affected by inundation. Adaptation measures in Susanna includes building anti-salt dikes, changing crops areas or crop fields to move to other areas, among other adaptation options. Susanna section deserves attention of authorities and other entities like NGOs, for example, to support them to lead with this phenomena, because the area is high vulnerable, and the population is is highly dependent in agriculture in prone flood areas, like flooded areas, and this population is highly dependent in agriculture in branya that are areas susceptible to coastal flooding. That's all. Thank you. Sorry for my English. I think. Yeah.
Quick question, yes?
Yeah.
Speak up or you
Yeah.
wait for the mic. I don't know.
Hello. Okay. Yeah, thank you for your insights, and I really appreciated the local perspectives as well throughout the presentation. I was curious on whether you found out whether there were any cultural mythologies related to sea level rise. For example, there's a community in Thailand, between Thailand and Myanmar. And during the tsunami of the early 2000s, they were able to predict the event of the tsunami because of the elders of the community. They called it the Great Wave. And when they said that the sea would ebb towards the coast, that they would have to retreat to the mountains. So that's just an example, but I was curious on whether there was any examples of like local mythology related to the events that are unfolding today.
I didn't get very well the question.
Are there any stories from the communities related
Yeah.
to what's happening, like from like historical stories? Like, did you speak to any of the elders that have like historically predicted what's happening? If that makes sense.
If I understand what is happening
Yeah, so
after.
related to climate change, are there any stories from the past, like from history, from like the local history, that relate to what's happening today?
What's happening?
Det Entanglements episodisk aumentação de nível de mar.
Sem comunidades?
Ja, historias na comunidade.
Se tem.
Yeah.
Ah. I think, as I said, if you see in part of the, I were there for some days and meet with, I had this meeting with them. But I think there is some stories, you know, in the communities, there are some people that think there's, I don't know how we call it, como se diz, deuses.
The gods.
Oh no, deuses.
Gods.
Gods. Okay. Some people believe in gods. Some of them may believe that all this is happening because some people are disobedient to the gods, and gods are sending these things as a punishon. There is this belief that is not natural things, but it happened because people are not what you can is obeying the gods. There is a story like that. But if you see in the presentations also, they think some of them, somebody say, maybe white people, they have this in their mind, are interfering in the sea in another area. That's why water is coming to here. So this is the different ideas. Some people think that that is good, not a natural phenomena, but is a good. Gods are not happy with the community, and some can think like that. No, somebody he's doing something somewhere. Putting something in the sea and water don't have the way to go, and it's coming to Guinea-Bissau, to Susanna. So there are some stories like that. I was working there and I see that there are people that think that climate change is occurring because of goods, It's not a simple thing. It's not some of them think that is a natural phenomenon, but there are people that think this is not is because of goods that is not happy with people. They think they are doing bad things, so it's like a punition.
Thank you.
Thank you.
Professor Fande, and now the floor is yours.
Okay. Okay, thank you.
Okay.
Good morning or is good afternoon. My name is Orlando Mendes. I am PhD student at University of Lisbon. Also, I work at Institute of Meteorology of Guinea-Bissau. This work is about my research for my PhD. Is about climatic characterization of the coastal region of Guinea-Bissau and its influence of mangrove rice production. My supervisor is Professor Marcelo Fragoso. I have to do this. Okay. Plan for my presentation is about 4 points. The first one, I will introduce. Second one is methodology, result, and conclusion. My first introduction is about Malmon project. My research was financed by European Union by Malmon project. The Malmon project have like objective to contribute to increase in productivity and the stabilization of annual mangrove rice in Guinea-Bissau. That for reducing dependence of the rice importation. Also to eradication of the poverty and hunger, and promote the sustainability of mangrove rice field in Guinea-Bissau. This project involves two universities, University of Lisbon, University of Wageningen in Holland, and 4 institutions. We have IGOT in University of Lisbon, we have ISA, University of Lisbon, we have IRD from France, and Wageningen in Holland. This research is for Guinea-Bissau involve many researchers. We have in total 12 doctoral, and we have 4 postdoctoral. All these doctoral and the postdoctoral have the different thematic to develop, but all this thematic is about rice field in Guinea-Bissau in different domains. We have the farmer to aid the doctoral to get some information in different villages. For the topic, we have ready. Yeah, this topics is about soil, about hydraulic, about ASCII, about crop, plant protection, tide, hydrosaline, ethnobiology, climate change, nutrition, coastal land, and remote sensing. In this topic, we have two theses have already been presented. This is you can see these two are already presented. We have in the way to present also our thesis in the few time. I don't know when. Okay. Now I will introduce my thesis about agroclimatology characterization on coastal region of Guinea-Bissau in this influence on mangrove rice production. You know, in West Africa, all agriculture is rain-fed. No rainfall, no agriculture in Africa. It's the same for Guinea-Bissau. We depend the rainfall, but the problem is now we have the irregularity of precipitation. We have a problem about saltwater intrusion in the plot due to sea level rise. We have also the problem of exodus of young people. Now the young people want to go to city to study. They don't practice the agriculture. This is another problem. Also, another problem is that the lack of state support for farmers. All activity is made by hand. It's very difficult for the agriculture. You know, in Guinea-Bissau, the rice is the main consumption for the population. You can say, see, if one Bissau Guinea don't eat rice one day, it means he don't eat anything. No rice, no life in Guinea-Bissau. It's why the rice is very important for Guinea-Bissau. I have some specific objectives. The first is to characterize the agroclimatic condition of the study area. My study area is in coastal region when we practice mangrove rice agriculture. Second one is to analyze the trends in air temperature and the precipitation. Also, we want to know, this study will establish the network meteorological observation from the coastal zone to know how is the temperature, how is the rainfall along the coast of a stud zone. Also, to understand what the peasant think about climate change and what they can to do to adapt to this condition. Also, we propose a calendar for rice production, and then we try to modelize what the rice production will be happening in the future. And then our study area is about 3 regions: Casio region, Oyo region, and the Tombale region. All these regions in the coastal zone, where the rice production is very important. For the data, we use data from Institute of Meteorology. This data is about annual, monthly, and daily rainfall and temperature. Use also the SHIRP data. SHIRP data is observation data, more estimate data by satellite. This is for characterize West Africa. What happened in around Guinea-Bissau in West Africa about precipitation. This is Malmo network. We store 10 stations in the coastal zone because, you know, the network from National Institute of Meteorology is not very, we have a small station to characterize good characterization. We have to install some station in the cost in the region of our research. It's why we installed 10 stations, new station, automatically station. Other data, we use also the data like NASA Power, the data, the soil data. You know, we have a lot of doctoral researchers. All the data is shared one by one. For example, I need the data from someone working at soil level, or we change the data. In this data, we share it, all of them. And also, we do survey about in 6 villages, 2 villages per region, to know what the peasant know, think about climate change and what is adaptation they use to cope to climate change. We use also a lot of tools to analyze the data, like Excel, Xstat, CleanPack, Instat Plus, Desert series rise to modelize the climate future production. About the result, you can see all of the country in South Zone, we have more precipitation than the rest of the country. This is, we can say this, in South, we can get until 200 millimeter precipitation by here. But in the North, you can get more. You can get less. You can see. About precipitation. In Guinea-Bissau, we have a dry season, you have a rainy season. Practically, it don't rain in January, in December, January, February, March, April. The rain can start in May until October or sometime in November. It's feast day of November. In May or in Août, we have more rainfall. July, Août, and September. What about the temperature? We can see we have, this is the high temperature is observed in April, in March, April. A lower temperature is in January, in the December. But the value is more than 20 degrees. This is mean temperature in general in the country. We try to analyze how is the precipitation in main station in the country. This is anomaly. We have a positive anomaly and a negative anomaly since 1960 to 2020. We can see in Bissau, Bolama, and Bafata. We have a trend, negative trend to so the precipitation is decreasing. We try to see if this decreasing is significant. But for Bissau and Bulama, no. We don't have a break in the area of temperature. If you see in Bafata, you can see we have a change, mean change since 1979. In first, we have some value after the value shift to become less. It means we have a significant change in Bafata, but in Bissau and Bulama, no. We have change, but it's not significant change. This is change, statistical change. This is for monthly, value monthly. Almost we have a reduction in precipitation. This is a total precipitation and the change by decade in 3 principal stations in the country. This is the monthly data about rainy season. Now we try to see the dry days over the year, the maximum annual 5-day precipitation and the precipitation intensity. We see we have an increasing intensity in some stations. This is the tendency for this index. We calculate this index by the daily precipitation. We see the intensity of precipitation are a significant trend. For the temperature, now you go to the temperature. In all of this station, we have change in maximum and minimum temperature. To know if this change is significant or not, we see for the maximum and the minimum temperature in Bissau, we have a break in the mean temperature in the maximum. For the Bolama, in maximum temperature, we don't have break. It means we have change, but this change is not significant change. For the minima, yes, we can get. For Bafata, we have also the change of mean in the past, in the now. It means the temperature is increasing in Bissau, Bafata, Bulama. For maximum is normal. For minimum, yes, we have change in minimum. It is about statistical change, the monthly, the January to December. This is the change for the monthly data for the same period. We try also to see what happened with the temperature, the day of temperature, when the day when the temperature is more than 30 degrees, the temperature more than 35 degrees. Also, this is the difference between the maximum and the minimum. We see this value is increasing. It means every year we have more days when the temperature maximum about 30 degrees is increasing. Also for 35 degrees is increasing. Also, you have the big difference between the maximum and the minimum. The trend is go up. We try to see about West Africa. What happened in West Africa? About onset of the rainy season. We see that moving from northwest from May to July. And it means the rainy season begin here to move to the north. And the end of season start up to south. It means in this part we have more raining days than the north part of the region. For Guinea-Bissau level, we try to see what's happening with start of raining and end of raining. We see we have more variability in the onset date than end of rainy season. It means the raining period become short. The raining period becomes short because we have more regularity in beginning. This is the start of raining. This is last of end of raining. This is the tendency, the day, the time of the period, the raining period. For statistical, we can see we have standard deviation from 13 to 20 days to onset date. But end of date, we have 9 to 10 days. We have more irregularity in start of raining than end of raining. About perception of peasant about rainy season, the peasants say in the past, the rainy season began in the May. The start of the rainy season was in the May, but now is in June. For end of season, they say in the past was in November, but now is October. It means the season is getting short for them. This is the perception. About evolution of rice production, for them, more percent of the peasants say the production is decreasing. You know, many peasants from the north say that the production is decreasing. But you see, some people in the south, in the country, they say the production is increasing. But you compare the 2%, we say more people say the production is decreasing in general term. And then about this analysis, we propose some calendar for activity. This is about activity of mangrove. The data is this. This calendar is based on analysis of rainfall since 1980 to now. Because in the north and the south, we have a difference. In this line, this is the center to the north, this is the south. The south, the activity can begin more early than the north and the center, because the rainy season begins in the south. After south, you go up to the north. It's why we have some different day to this. Okay, with the network for mangrove, we try to see how is the rainfall and how is the temperature. With 10 new stations from Project Malmon. We see for the temperature, for the rainfall, we have variability south to the north. It's like observation data from the Institute of Meteorology, like this date. We have more precipitation in the south, in the north we have less. To see, this is the 10 station from Malmo, San Domingo, El Ala until Cafin. Look at here, we have less than 1,000 millimeters by here. But here we see all these stations have more than 2,000 millimeters by here. We try to analyze the data from 4 years. Some stations don't have data from 4 years, but you can see the difference between the same year or the same place. We have a lot of difference. It means we have a lot of variability of precipitation in the country, the south to the north. We try to see also for the temperature. We don't have many difference in the temperature. We try to analyze. This is the hot months in here is the first one is we have April and January. The hot one is April, the less hot is January in here. But if you compare also the different station, we don't have many difference about mean temperature in these 10 stations. We try also to analyze. This one is about solar radiation. We don't have a lot of difference between this station. This is relative humidity. This is wind. The direction of the wind is the frequency of direction. This is about the new station. In this part, we show only 3 stations about wind. And we try to modelize what will be the production in the future. Here we have 2 varieties of the rice. We have Kaulak, we have Ejur. This is the data observation data. This is the cycle. This is the short cycle for Ejur. This is the middle for Kaulak. This is the simulation, the day of simulation. This is the observation data. This is the simulation production for model. In this data, we have to know in the future what will be happening about these 2 variety of the rice. With rice, we use also the scenario and the different time. You can see it means the cycle for this variety will be affected. If the temperature is rising, the cycle of 19 days will decrease because if rice needs, example, 2,000 temperature. If the temperature increases, it means these 2,000 will be reached in less time. It means the cycle will be decreasing. If the cycle will be increasing, it means the production will be affected by this increasing of temperature. The temperature increase, the cycle become more, I don't know what to call that, and the production will be affected. But if you see, the short cycle will be more affected than middle cycle. This Kaulak will be less affected by climate change in different scenarios than the first one. First one is short cycle. Short cycle with more temperature will be affected and more than middle cycle. In terms of conclusion, the mangrove rice production in Guinea-Bissau is at the critical point in the fight of the climate change. In this case, what do you have to do to cope this climate change? We have to selection of adapted of resistant variety. We have to know what kind of variety of rice we can take. Also, monitorization of weather is very important to give information for the agriculture. Also, water problem is to know how to manage the water in Bologna. Other problem is to continue to train the community about this kind of information. This should conclude that the mangrove rice cultivation is essential for Guinea-Bissau's food sovereignty will depend on the political decision, investment in technical knowledge, in valuing local expertise. This work represents a valuable contribution to support this decision and promotes sustainable and resilient agriculture development. Okay, this is the end of this presentation, but I have one video for 5 minutes. I don't know if we'll have time to see that. It's about all this, it's about Project Malmon. Okay. I hope you understand my English. I try.
Yes. I wanted to know whether people were using any of the older African rice species, which are more salt tolerant, to contend with some of the problems with saltwater intrusion.
In the north of region, in Cacheu, they use rice, the African rice, more African rice. But if you see in the south part, they use another variety of rice. You know, for Jobel and the Fløistrup culture, use this kind of rice in ritual things. It's why they have all time this variety of rice.
But people aren't using it to deal with the problem of salt intrusion.
What?
But if I understand you, they are not using the African rice to deal with the problem of salty water.
Oh, the African rice is more resistant for salty water than,
Exactly.
yes, if you compare with another variety.
Right.
It's,
Okay.
yeah.
Thank you.
You're welcome.
Okay, so good afternoon. I hope you enjoyed the lunch and the coffee and the cold water. So we will start again. My name is Sune Steffensen, and I'm chair in the Danish Institute for Advanced Study, as well as professor in the Department for Culture and Language. And since the next two sessions will have a high ratio of humanistic anthropological work, so I took the chance to chair this one. And the first presentation is by Amelia Frazao Moreira. Nailed that one. Conservation and human, non-human entanglements in Guinea-Bissau, frictions and futures. Looking so much forward to that. Thank you. Let's take a bit, perhaps, yeah, like that. And right now.
Okay, okay, okay. So I will read, sorry, but it's easier for me to not lost and to say what I want to say in this time. So first of all, I would like to express my gratitude for this invitation and the opportunity to discuss the reality of Guinea-Bissau. It's also what I want to present you, and I decide to share some data on conservation in Guinea-Bissau and reflect on it through the lens of my own experience. So, as you know, as you may be aware, the National System of Protected Areas cover approximately 15% of the national territory in Guinea-Bissau. According to data from BioGuinea Foundation, 26.4% of the territory is protected, corresponding to the coastal, marine, and terrestrial protected areas. Guinea-Bissau is home to 5 national parks, 2 natural parks, a biosphere reserve, and a marine community area.
These networks reflect the country's commitment to the international conservation guidelines and standards. Allow me to review the major states of conservation historically and worldwide to situate Guinea-Bissau. First, the Fortners conservation or fence and fines approach, exclusive and coercive, linked to a romantic idea of untouched and wild nature, which was and continued to be in some countries the basis for the creation of protected areas from which the human population is removed. This is followed by nothing because, okay. It's followed by the community-based, you can see, yeah? Community-based or participatory conservation model, which nonetheless follows broader global scientific and governance models. A third model, according to the authors, more recent, the neoliberal model links to process of commodification and heritization of nature. Perhaps we can say that protected areas in Guinea-Bissau were created and are managed in accordance with the community model. That, after all, as Brosius all state, is a paradigm that has raised new challenges and dilemmas, such as concepts of community, territory, locality, conservation, and customary law. Concepts that are worked in political, varied plans and programs in disparate locations. Regarding species considered endangered in Guinea-Bissau, according to IUCN Red List, that is species perceived and endangered according to what my colleagues call endangered sensibility, that guides the world, valuing them based on scientific knowledge linked to certain values, emotions, and feelings, interests, and points of view. You can see the numbers here, 12 plant species and 52 animal species that are considered threatened in Guinea-Bissau. In short, we can argue, as Descola pointed out, that preserving species and ecosystems by managing them just like temperate zone states forests was another way to assert the merits of the civilized mission the colonial nations had taken on. But on the other hand, these figures highlight the rich biodiversity of Guinea-Bissau and point to the need for this protection to ensure long-term survival. The reality of life in protected areas can be characterized by the idea of friction in the sense that Anna Zinks give it. When universal global forces like capitalism or conservation encounter local culture and practice. These contexts are thus zones of engagement between global projects and local realities, generating both conflict and collaborations. The attempts to involve communities in this participatory model of conservation in Guinea-Bissau are mostly limited to performance staged during meetings with experts or executives. There are disparities between those who are geographically and political in the large sense of the word, close to the headquarters of protected areas, and those who are not, particularly in terms of participation and the support received during initiatives and projects led by organizations, special NGOs. This has led to disputes and conflicts, as illustrated, for instance, by the case of Cantanhede Park, reported by colleagues Marina Temudo and Joana Souza. But also, simultaneously, and sometimes even led by those experts' disagreement, collaboration are also taking place. From what I observed, this collaboration of people to conservation programs, or if you prefer prefer using another concept, the resilience of local socio-ecosystems results from people's adherence to conservation program, that is by participation in projects, adopting the rhetoric of the benefits of ecotourism, reconfiguring of the traditional meanings given to vegetal and animal species that are also considered vital by conservationists, thus incorporating scientific knowledge with local knowledge, or attributing of a sacred value to parts of the forests which had up until then had little symbolic meaning, knowing of conservationist interests in mato sagrado, sacred forests. Conservation is, after all, a new stage in a historical process. Using the example of Nalu people of Cantonese in a necessarily quick summary, some stage, the periods prior to the 15th century, the migration from the Mali region and settlement on the coast of Guinea. Here, Nalu learned from the Baga people about flawed rice cultivation in a mangrove swamp, what led to the changing of the production system, to a different appropriation of the territory and the new elements of ecologic knowledge. Another important historical milestone was the Islamization in the early 20th century under the influence of the political dominant Fula or Pole ethnic group. This led to the reconfiguration of the story of the territory's foundation. Also to the loss of importance of pre-Islamic beliefs and rituals of territorial appropriation, and to the transformation of the view of nature. This is to say there has been a change in symbolic appropriations of the territory and the transformation of historical heritage. From 80s and 90s orders, we assist to the incorporation of technical agricultural knowledge and new varieties or species with the development projects that similar to Eric's talk about. And more recently, the establishment of conservation programs. In 1993, the Iniciativa de Cantonês, Initiative to protect the forests of Cantonês, organized by 3 Guinean NGOs, Aaby, Tinigena, and Alternag. And in 2011, the creation of National Park of Cantonês. This recent process of placemaking, and this is one of my arguments, are mirror to early process, particularly those from the colonial period. For instance, this colonial episode of Mansua War occurred in 1913, which was part of pacification campaign in the then Portuguese Guinea. The pacification campaign were colonial military campaigns to control local rebellions. Sorry. In the case of the Mansua War, the Portuguese involved the Fula ethnic group to help them against the Balanto of Mansua. At the end of this conflict, the victorious colonial administration rewarded the Fula chief for this service and support. In the words of the Regul Cacique, traditional chief and one of the elders, Nalu, in 1995, reported the oral story. I will tell the only short version. And he said, the Fula Alpha Mamadou Selou went to war at the time of the Mansua War and won that war. The Portuguese offered him a reward, but he turned it down. They sent for him and asked him why he had refused the reward in money. He said he had left his own land and that he needed a place so that he could eat. He wanted land. All knowledge chiefs met in Cassin. The Cassin chief said he refused to give land to the Fula. The others supported him. But another chief, the Cadic chief, took another position and said that if all of them refused to give land, the white man would end up giving whatever land he wanted to even it, if he were by force, saying he had already given him the Livre de Reinança, Book of Royal Land. So it was better for them to choose the land they would give him. They decided to give the north of Bucar Peninsula. In short, faced with external impositions and the threat of losing control over their territory, the Nalu of the past responded by reconfiguring that territory. Today, confronted with the pressures of nature conservation, the Nalu seek to ensure survival and cultural continuity through a dynamic interplay of contestation and collaboration. And let me now try to build bridges for the future. We are aware of the pressures on huge forest areas, mainly due to perennial tree crops, special cashew, and timber exploitation for the international market. I don't have many data on cashew and timber exploitation. We have not so many time, but in short, all studies show that the increase in the production of cashew has changed the traditional agriculture system of slash and burn in rotation with serious environmental consequences: deforestation and forest degradation, soil depletion, and biodiversity loss. With regard with timber, this map of the study conducted in 2012-2014 to Tinigena NGO show the areas of Guinea-Bissau where this extraction is highest. And we can see that is very constrained. So, in summary, according to FAO, from 2000 to 2024, the total area of humid primary forest in Guinea-Bissau decreased by 8.4%. The conservation is therefore vital in the face of this extractivism. But it's necessary to find new models whose conservation respect the rights, the cultures, and the survival of local peoples, what I used to say, a fair conservation. A new model is the conservation based on ICA, territories and areas conserved by indigenous peoples and local communities. Natural and or modified ecosystems that hold significant biodiversity values, ecological benefits, and cultural values voluntarily conserved by indigenous people and local communities through customary law and or any other effective means. The ICA, by definition, involves the integrated combination of the following elements: an indigenous people or local community, a preserved territory or area of cultural and environmental importance, and a continuous form of local governance. We, Bucar Indjai and other Guinean colleagues, carry out a consultancy on ICAs with the objective of drafting a proposed decree law for their regulation in Guinea-Bissau. The goal was to organize the conservation of socio-ecosystem in line with traditional forms of protection and governance, empowering communities. I don't present the details, but if we have time, I can explain the methodology and so on. With regard to species conservation, our vision is to carry out interdisciplinary research projects that explore human-no-human relationship, adapting a multi-species perspectives. We seek to understand and foster forms of coexistence that enables equitable conservation process. In some examples, the project where humans and chimpanzees meet, assessing sympathy through Africa using a multi-tiered approach, and in which we conduct a study about chimpanzees' diet and human chimpanzees' overlap of wild fruits, with the objective of understand the costs and risks that people and animals impose on each other in shared environments. Another example is the project entitled Promoting Public Health in the Biodiverse Agroforest Landscape in Guinea-Bissau. In this context, a study was conducted with the goal, which goal was to enhance capacity to manage human-wildlife interactions and support conservation and human health. The team, not me, a biodiversity monitoring across the Cantanhede Park to generate spatio-temporal data on large mammals, distribution, and health. And on human sides, we worked with local communities to increase knowledge about One Health, zoonotic disease, and pathways of transmission. Of this was included in the action plan for the conservation of mammals in Cantanhede, trying to cross the data from human people and mammals, no human mammals. So under the One Health approach, biodiversity conservation and research in Cantanhede Park now include collaboration with the public local health sector. So in conclusion, we can argue that the process of conservation have hegemonic and universaling dimensions with dominance from the global north. However, and we are witness reconfigurations of traditional meanings and practices resulting from this conservation process. However, we are aware to the needs of conservation, particularly of forests and mangroves. The emerging attempts to shape new models for the future call for reflection and critical discussions. And thank you for attention, and thank you for all communities, local authorities, research assistants, and colleagues with whom I had the honor of working.
Thank you so much. I think we have time for one question, or perhaps two. Yes.
No.
A lot of the logging in Guinea-Bissau is usually illegal logging connected to transnational organized crime. So combating it is not only a matter of state policies, but the logging in Guinea-Bissau is usually connected to transnational organized crime. So it's how do you see transnational organized crime? Like how do you stop illegal logging without having to deal with transnational organized crime?
I think I don't have the answer, because it's one issue that is a very not resolved in all the African countries. Our expectation is that if we empower local people about that forest, that are their forests, they will react, but is hope more than certain. But it's our project, our vision is that if we empower local people about their landscape, and if they use in continuity with the traditional models of governance, like Eric explained in this morning, it's easier that they resist to other kind of strategies.
Okay. That's very nice bridge from Amelia, because you mentioned that Bucar you did the project together. So therefore the next speaker, of course, is Bucar Indjai. And so Bucar will talk on the contribution of forest products in times of crisis in Guinea-Bissau. So the floor is yours.
Good day. Thank you. My English is not good, but I'm trying to talk in English. It will be kind of a bilingual talking. So this contribution is about how forest is important for Guinea-Bissau, for people in Guinea-Bissau. So we consider 3 times of 3 periods that forest was very, very important for us, for Guinea-Bissau at all. So this is to say that during the war for independence, Guinea-Bissau the forest was very, very important for forest, and the forest product was very important for Guinea-Bissau. In that period, many people use the forest and forest product to eat and to do many things. Yes, I lose. Most of the people in Guinea-Bissau, they use the plant for many things, like for food, for medicinal plant, and construction, and craft, and sociocultural, different sociocultural activity. And the knowledge about the plant is very important, and it can vary from the different region. From the region, even in the same region, can find sometimes the same plant have different how people use it. I have one case here for this species, Psychotria peduncularis is one case, but there are many other examples that I can bring. For example, Psychotria peduncularis is the first time I had information about Psychotria. It was in Bijagos. Bijagos, this plant, they use the root for snake bite, and it's something like when snake bites someone, the first thing that you have to use is to chew the root and then to cut the venom after to do the. So this is one plant is very known in Bijagos. But also in Philippines, they know the leaf of the Psychotria, like some plant that when you are in parties, for example, some parties of a ceremony party, people can take some days on drinking. But if you want to, sometimes there is competition for drinking. So if you want to stop the drunk, so you can chew the leaf of Psychotria to finish your drink. And the other in Majacos, in south of Cachao River, the child eat the fruit. So, but Bijagos don't know how, if, for example, the leaf can, Bijagos also like to drink, especially palm wine, but they don't have this information of chewing the leaf can stop the drunk. And these people also, they don't know if the roof, you can use it to break the venom of snake bite. So this to see how different people, different in same country, but they have different knowledge about how to use plants. So this is some contribution that we can identify some of them. For example, during the war in 1963 to 1975, if you ask in that time what people used to eat in that period, they can say many fruit, many forest product that they use to eat. Today, for example, in this new generation, if the older people are telling what happened at that time, they say, "Oh, it's lying, it's lying." So like they don't have idea, or they just do some kind of joke. Contaminated. That's not contaminated. That is, it's not true. It's not true. That means the things that people use in that period to survive during almost 11 years in the forest. Because that time, most of the people living in the interior, in the countryside, most of them go to the forest. They live there. They build this house. Everything was the forest that the people use it. And also in 1998, 7 de junho, 7 de junho, it was one period also most people leave Bissau to different regions to stay there. But the different institution who helps, they didn't cover all the country, but the forest and people in the region, there is one who supported the population who have been refugee to the villages. And also in 2020-21, COVID came. That was in Bissau, in center of Bissau. And for this period, people, the government closed, nobody goes out. So everybody have to stay here. So what to do in that period? The market is closed, every place is closed. So and COVID in that period. These three scenarios during the wars, during the 7 de junho, and this data was bring this reflection about the contribution of the forest and we can see, for example, this Discoria bulbifera. It's kind of inyamb in forest that nobody now don't like, because the process of cooking this inyamb is very difficult. You have to know how to cook it. Oh, this is more. Okay, that the first picture at left is kind of inyamb forest inyamb that people use a lot during the colonial world. And you have also Parkia biglobosa faroba. That also is a very important product that people use. They use it for to do some juice. You can use it also mixing sugar or knee. So now people associated with malaria, prevention of malaria or this Parkia biglobosa. And we have Nauclea latifolia sarcocephalus. That also is very important. Amelia called this is a group of that Amelia called fruto de meninos. Child's like it. But the roof is very, very important for the woman, for a child when child have a stomach pain. So every mothers know that is the first thing that if child is crying, and then you can use the roof of sarcocephalus. And this we have Ovaria shami, is one other, they call it banana sancho, banana of monkey in Creole. So this one also is a very, very important one that the child used to take. Even some adults, if you're hungry, if you go to the forest, you can eat it. And the roof also of banana sanctuary, they use it for medicine. And the leaf also, if you have some cold, they use it. And this side we have Avicenna germinates, the mangrove. Also, this if you tell someone more young, the mangrove, you can use this, they don't believe because they never did. But people during that time, this was one of the most important food for the people. And the process of cooking is very, very, you have to know. So this knowledge, like new generation, they don't know, they don't believe, so nobody is using it now. So this one, Cassina oliviforma, is called is also in Creole, manganasa, is also is another product. The pulp of the red one, you can eat it a little bit sweet. And then inside is have some kind of like amido inside that they also is a big process of preparing to make it food. This is some example of some contribution of the edible fruit in Guinea-Bissau, but there are big lists of many things many people use. So I bring this example of diversity of different species, what you can get from the species. For example, this palm, this is Elaeus guineensis, the palm tree. It is very, very important in rural Guinean sides. They call it oleopalma. Then there is very important because from the tree you can, they use it to, not in the forest of Elaeus guineensis, they can produce the rice, pampan, sometimes, because the concentration of organic is important there. They can do pam there, but they can do many things in the leaves and tree and even material de construction. They can do it. And this our typical traditional prato plate is a caldo Stabell, is from this Elaeus fruits pulp of Elaeus guineensis. And we also have the kernot. That also, if you are hungry, you can chew it and drink water. This, if the people say a lot, this is one of the most important. From there you can get palm wine. You can drink it when it's fresh, like a juice. When it's fermented, you can, if you drink a lot, you can even be drunk. So, and this one you have two kind of oil that you can extract from the fruit. You can get this. This is red from the pulp. You can take this red, and this one yellow, white. You can take it from the kernot. So this was and the kernot of Elaeus guineensis was one of the products of exportation of Guinea-Bissau during the colonial time up till 1980s. It was one of the products that we exported. But as cashews coming, and now we don't spot this, but it was in the group of the this carouse and in that time it was carouse and the groundnut. It was a product the exportation. Now is It's only casual for the exportation. So this also is a Borassus. Borassus ethiopium is more known in Guinea-Bissau, but in 2016, one researcher of Costa Marfim discovered that Borassus in West Africa is not only one species. There are two species. There are Borassus ethiopium and there are Borassus achias. This is one example of Borassus achiasi that we also confirmed in 2024. That is one species that we can find in Guinea-Bissau. And as I discovered that many of those individuals that we use to call or to think that is Borassus ethiopium, there are Borassus achias. We don't have yet one inventory to know one of them who are more important in terms of the population. And this species is very important also because all the parts of the tree, it can take up to 25-meter high. Is one of the most important tree of we use for construction. Most of the house in Guinea-Bissau, even in Bissau, in the Bissau city and the interior, is from this. Now even we don't have enough to build the house because the people have been taken. Now some material, the root of this come from Guinea-Conakry because one of the stick of this for 6 meters can buy it up till 4,000 francs CFA. So it's one, because some people dedicate all their life to cut and to sell. So this part is a different part from the left to right. You can see the fruit in different stage of maturation. It has how people use it to eat. So you have this one is a kind of gel, so it's sweet and this normally it can produce every year during the year. It's continued, but more important time that is when in April, for example, from the April, May, is very important because if you go to the field, you can take this and have a drink water and eat water and you give it energy. So the second line of a picture. This one is this is another stage of maturity. This is a pulp of fruit. When it's in this, it don't have. It was passed in this stage. So is this people can eat the pulp. It's just like it have very fibers, and it has pulp also. That's pulp people use it. But important for this is there is one species in the southeast of Asia that is a Borassus. I think it's a glabellifera. They use this tree and the fruit to produce wine. Even in Guinea-Bissau, there are Mansuancas. The technique that they use to produce wine of this, it produce a lot of wine, but the problem after it can be 1 month, more than 1 month after the plant die. But in Burkina, other country, they have other experience to produce wine. And in Asia, they produce sugar with because it's very sugary. Yeah. So this you can burn it or you can cook it, and then you can. But some studies confirm that they did experience of with this pulp to produce ração for the chicken. They mix with maize and manioc. They look that those chickens that they use to they mix this with maize and other ração. The conclusion that they found is those chicken that they have mixed, they alimented with this, the gemma of those chicken was more yellow than those. So it's also something that you can introduce for chicken alimentation. So this sort is a other stage after this for pre-germination. So from this stage of pre-germination, that also is other important phase that people use it, and this most of this from this from July up to July is a period that the food is not very. The pampa is not yet. Pampa is a cultivation of rice, and the food is not very enough. So this also is very important in that period in the area that they have this species. So they can cut it inside, and you can get this one. So this also is just like a coconut, but it's more softy than cocoa. You can chew it, and sometimes you can cook it with palm oil, and then you have a good food for that day. So this one is a palmito. This palmito, this is after germination. There is a small plant like this. So this is a part, the embryo that is growing. So in this stage, people can use it to eat, because it has a lot of amido, just like manioc, maize, this thing. But the problem of this that I say, is not all the country use it. This experience of using it, you can see it in the northwest of Guinea-Bissau, from Cacheu and Chungu in south. So even they associate with manjaco, they know this technique of cultivation of palmito. If you go to Kanchungu, palmito is one of the things that now is some important activity for the woman to increase their economy or production of the palmito. Yeah, this is almost how aspect of the structure of the forest of this species. Two important species. You can see palm trees. These borassos, they associate with other species. Palms, you can see forests associated with other, but sometimes you can see only forests of the Palmaelais genus. Yeah, also the medicinal plants in Guinea-Bissau is very, very important. Like I say, most of the people use medicinal plant for their treatment. And professional who use this, they call it different names. You can see the curanderos, Jambacos, Balovero, and Muro. So all of them use part of the plant. Some other is spiritual, ritual, but some of them use the plant to make these. And this group, in terms of the health, they are very, very important in our society. And because sometimes people believe in days in Jambacos, Moro, even some people believe until you go to the hospital, you will go to ask Moro Jambacos if I should go to the hospital or no. Sometimes it depends. The Moro can influence you without going or believing more than tomorrow. So that's in time. Last time there was some collaboration with the hospital to train, because there are some kind of sickness that they cannot do, they cannot resolve. But like people believe more than them, more than hospital or than. We have the system that we believe a lot of the ceremonies, of course. This is a kind of jambacos, curandero. This is a balobero. This is one picture when he was walking in Kanyabac about a medicinal plant. This is a casal. This man and this is the woman. They went to this balobero to thank him because the woman didn't have child after several years of marriage. No, they went to do ceremony with this balobero, and then after the time, 3 months later, the lady will get pregnant. So they believe that because they went to this balobero, and they went there, the man and the wife went to make kind of gratification or and then they take palm wine, and then it's not very expensive that normally you do. When the woman get the child, they will go there again to thank him again, to show that he has got the child. And then, okay. Yeah, this is just to make a small story about since when the studies, different contributions about plants started in Guinea-Bissau, medicinal plant and edible plants. So it has taken a long time since work from the Costa in 19th century. People, Portuguese in that time, they wanted to know what the local people used to. And then after that, other studies came out. For example, Walter in 1946, Espírito Santo, very known. He's one Santomense who worked at Guinea-Bissau and that time is one of the most collector of planting in Guinea-Bissau. He has something about 4,000 or 5,000 specimens that he collected. And yeah, this was a contribution that we selected, that the first contribution in this field of research about the plants. And also we bring some books, some publication that has done about the plant. For example, Espírito Santo, 1963, it was one of the first work, bring many information like name of the plants and different uses and local names and many information that it brings. Just ethnography is one of the first publications who had made a very big impact in terms of we are trying to learn about the plants. And also, since 1963, in this period, we didn't find another very important publication. And we found Moreira, 1995, if you see, because this also you can understand, because it was during the civilian war. No Portuguese go again. The researcher, they are no more going there. So this other book of work of Amelia, it was very, very, very important because he has done some characterization of the how people use the plant, relation with plant. And this book for me, who are starting to learn about the ethnobotany, make me have more interest. Because in that, the first one, Spitsand, bring the local name that I can see. Not, for example, Ovaria Shame, if you call it, but you don't know it's banana sancho. Sometimes, so from that I start to get my interest. So when Amelia bring another information like how is the relation the plant to the people and people to plant, explaining some the first time I read this book, I started to remember some story that my grandmother told me. But from that I can I was imagining who wrote this this work. It can be very old woman, because that kind of story only old people can tell. And when I see Amelia, so I didn't believe her that if she's because it's all very, very deep that you can hear only when is someone who knows history deeply from can tell us. But he also maybe has a good informant too. But everyone who likes this video really can see. And this also, Malais is from Belgium. He also worked at Quintana. He also did some kind of the ethnoecology, distribution of a plant and the plant use in that trade. This work also, it was very, very interesting to stimulate to know more about the plant, how people use the plant. And then we have others contribution that Catarino is one of the most, actually, most researcher continue to work with in Guinea-Bissau. This one is a collection that bring all the others contributions before, and in one book. This contribution is one of the most important book about flora and vegetation of Guinea-Bissau. It does, for example, you can have every species, distribution of the species, different use, phenology, and many information this book brings to us. And also, Gomes, the other Portuguese researcher, they started also to do some experiment with the composition of the species. And this book is one of the first that brings some 20 species of the medicinal plant published in 2000. So it was one of the important also in terms of the giving from by the other level, because it brings a part of the composition of the plant, because they work with some pharmacists, pharmacologists, and then it brings this information. And Verjan also is other researcher with Malays again, and also did the characterization of the and different use of plant in Cantonese zone. Also, we have a contribution of forests from Caritas, Guinea-Bissau. I'm taking time. My time? 3 more minutes. Okay. Okay, thank you. Okay, yeah. And this contribution, this contribution is from Caritas and the other from Amelia. So this is this other is other contribution that we had in Ireland. So only this is one other history is very important, the work that we have done in Ireland, how to do the research, how to enter in community, how to ask people to tell you about the medicinal plant. Current knowledge about the plant. We have almost 1,500 species that was identified in Guinea-Bissau, and 247 of them are used as medicinal plants. And in West Africa, those species were identified in Guinea-Bissau. 438 species occur in Guinea-Bissau, but we don't use all of them because of the, like I said, the variation of knowledge of how to use the plant it can be varied from country to country, from region to even the same region. So this also is what we have done in Guinea-Bissau, and there's still many things to do in Guinea-Bissau. And then we have started to do some work, for example, extraction of the oil to know composition. This is that we are doing in this moment. And this one, other colleagues, we are also working to do extraction of the oil, essential oil for bioinsecticide for different. For cashew, for example, have some different sickness, and on we are trying to do this. So a story of COVID start here. Like my time is finished, I can say thank you for this because we have more picture, more slides to I don't know. Yes.
Thank you so much, Bucar.
You're welcome.
And yeah, thank you. Yes, I think we'll have to see the rest of the slides another time because it's getting late and we have more presentations after the break as well. So we'll have 30 minutes break now. So 5:30 something. Yes.
Yeah, thank you.
3:35 we'll start again.
Okay, thank you, son.
Thank you.
Yeah, welcome. How was English?
Very good. I'll turn off your microphone if you give it to me. Right, we will resume for our last session, which is, I've got my papers, which is continuing the anthropological theme, of the theme of environmental anthropology. And the next speaker is Joana Roque de Pinho. Yes. Oh no, more in Portuguese. Fotógrafos de Kabambol, rice farmers as environmental historians in Cantinhas National Park in southern Guinea-Bissau.
Thank you very much, Sune. Good afternoon, everyone. I'm very happy to be here and very grateful to the organizers for having me here. It was very unexpected and I feel very honored. And I changed the title a little bit. You will understand why initially it was called Rice Farmers as Environmental Historians, I hope. And I'm actually really not a specialist of Guinea-Bissau. I spent maybe in total almost 1 year of fieldwork. The last time was in 2014. I'm actually a specialist of drylands and pastoralism, and I usually work in Kenya and more recently in Mongolia on environmental change and more recently religious changes. So I want to start with this disclaimer that I haven't been in Guinea-Bissau for 11 years now. I haven't kept up with what's happening in the country, with the recent literature on these topics. I tried to catch up in the past week. And I'm feeling a little bit self-conscious among all these experts who've done long-term work in Guinea-Bissau. So please correct me and feel free to add some depth to what I think is a bit of a superficial analysis. Today, well, you've seen the photo exhibit, some of you, I think. So basically, I will report on this 4-month fieldwork I did in 2014, where I engaged local rice farmers as collaborative researchers through the medium of photography and storytelling. And I'm very grateful to the DAIS, Christine and Sune, for this opportunity to revisit that project. I realized preparing this that I've forgotten a lot, and for the opportunity to share again my collaborators' work. So just to clarify, I'm not the one who took the pictures and is telling these stories. These are the stories and pictures created by this group of rice farmers in the southern part of the country. And they also curated this photo exhibit. So they selected the pictures and the stories they wanted to see shared outside of the country. So my story today focuses as Amelia and Bucar and others in the southern region of Tombali, on this Kubukare Peninsula, which is also the Cantanhede National Park. This area has been under some form of nature protection since the 50s, the target of many, many, many development projects in the 80s and the 90s, and finally gazetted as a national park in 2011. And again, correct me if I'm wrong. And interestingly, it has been managed by an NGO until 2014, which is when I was there. It's a park that hosts about 25,000 human residents of more than 10 ethnic groups who use the land in contrasting and complementary ways. And the first record, if I'm not mistaken, and Amelia mentioned this also, first record of human occupation dates from the 16th century. So Cantanhede is made up of a very complex, dynamic, and diverse landscape. It's an ecological mosaic that includes different types of forests, wooded patches, mangrove, 2 types of savannas, many different cultivated fields and orchards, traditional and commercial, fallows, palm groves, pressure zones, which is how park management calls the villages, and also spiritual territories. All of this is and more is this diverse landscape and very dynamic landscape of Cantanhede, shaped by a long history of human occupation. My focus is on the village of Kafal that you see there. And this is some of the forests that Amelia talked about, the dense forests that have been the main target of conservation efforts for a long time. So this area is crisscrossed by many roads that people, but also non-human animals use, like the chimpanzees. And an important background that I want to share a little bit to the photography project is my individual postdoc project, which I carried mostly in 2011. And I was interested in how different groups of people who have a stake in the national park, from farmers to park management staff, NGO workers and scientists, how these contested concepts like what is nature, what is environment, conservation and forest, how are they understood locally? Deforestation, when scientists talk about deforestation, does it make sense to the rice farmers? So I wanted to understand by interviewing people and conducting ethnographic fieldwork, which I did for 6 months, how conservation policies in the park, like zoning and land use restrictions, were they shaping farmers' understandings of human environmental relationships? I've seen that elsewhere in Kenya during my PhD work, so I was interested in asking a similar question in a totally different environment. And my fieldwork was very much shaped by 3 aspects, which I didn't really anticipate. In interview after interview, I realized that my local interlocutors were using a discourse that seemed to coincide with the discourse that existed on the park, published in NGO literature, scientific literature. So people were too nicely telling me over and over how much they like the forest, how much they were threatening the forest, and how beneficial the forest is to them. Once in a while, somebody would say, yes, but the savanna is also very rich in medicinal plants, and the savanna is very interesting for us, and so on. So the data was consistently, well, what people were telling me was too neatly aligned with this external discourse on the park. And then I also was running into the problem of project fatigue. People clearly were tired of being interviewed for one more project, be it development or conservation. And there was this emerging theme, though, that I started to be more interested in, which was people sharing with me local experience, their experiences of a changed rainfall seasonality. Like Orlando mentioned, here also people were mentioning the loss of 1 month of rain and how their wells would have salt water, not salt water, sorry, their wells would run out of water earlier than, not earlier than before, but way before the rain would come. So this was this was an emerging topic for me. But I want to spend a little bit of time on this external discourse on Cantanhede. I don't know the date of this document, but this is an official document, a regulation of the park. And they describe how Cantanhede represents the last vestige of subhumid dense forest that accordingly was occupying a much, much broader area of Guinea-Bissau. And nowadays, or back then, maybe 20 years ago, it was the northernmost primary forest in Africa. This type of, this discourse was also in the 90s, 2000, present in this type of NGO literature that talks about these last fragments of continuous forest going extinct. It's important to ask now or never. There are only a few remaining giants left, these big, tall trees that are the last stand against the desert. So this desertification narrative that was very common at the time. And I was asking myself if this is also a case of misreading the African landscape, which was described by James Fairhead and Melissa Leach, where they showed that forest, so-called fragments in the savannas of northern Guinea-Conakry, were actually not fragments of a previously continuous primary forest, but instead islands of trees created by people. So I thought these questions were interesting to ask. And more recently, and including in, it's normal if it goes like this, including in papers co-authored by Amelia, I've seen Cantanhede described as an anthropogenic agroforest landscape. So I was a bit surprised to see that in the most recent management plan for the park, the focus is still the dense forest, and whatever exists is being degraded. So the assumption is still that this landscape should all be dense forest, and it isn't because of people and what people do, like slash and burn cultivation, they migrate, the market economy is destroying everything, they're planting cash crops, and there's commercial fishing, all these threats to the forests in the park. But again, I remind you, the landscape is not just forests. There are other important ecosystems that people value and their livelihoods rely on those ecosystems, like the boulaignage, the savannas, and so on. Back in 2011, I conducted participant observation by accompanying the NGO that was managing the park at the time in their actions of sensitization or environmental education. At that time, they were focusing their efforts on the north of the park, where there were lots of conflicts. The park rules were expanding in that area at the time, and local people were not happy about them. And so the NGO would show up in these villages, also accompanied by the state, so NGO, state, state forestry officer, and they would have this type of discourse, after God, the state. And we, NGO, represent the state, which is a strange statement. And today we came here to show you the correct path forward. So we outsiders armed with, well, more or less outsiders, but armed with the power of the state and scientific knowledge are coming to teach you how to use the resources, protect them, and not destroy these forests. A few months later, I attended this very, very tense meeting, also in the north of the park. This meeting was called because these same people the same people and others, so NGO staff and forestry agents, actually beat a young farmer who was cultivating his field in the forest or somewhere in the north of the park, beat him, undressed him, humiliated him, and this was a big deal. People were really, really upset about it. This happened also as some houses had been burned by by the NGO workers for allegedly existing inside a newly delimited wildlife corridor that people didn't know about it. And finally, I witnessed how coming across an elderly couple who was also farming in the forest, they were migrants from the north, these NGO staff and the forestry representatives really rough-handed these people and stole their rice harvest. It was really shocking to me, but most shocking was when I shared this with a European acquaintance who works for the International Union for the Conservation of Nature in Bissau. He's European, and he said, violence is the only language that Guineans understand. And I was very shocked by that. So clearly, at least at that time and in that area of the park, conservation didn't coincide with human rights. And I bring this up because of the focus on global inequality. All over the world, conservation is often militarized, and in the name of conservation, people actually suffer in many, many ways. So this is the background to the photography project. I adopted participatory photography, which I've done in other places before. It's also known as photo voice. And the principle is that local community members lead the research process as experts of their own realities and researchers by using the medium of photography and storytelling. So in the context I explained, I wanted to use this approach as somewhat decolonizing to address, on one hand, the problem of project fatigue, to move beyond this appropriation of the conservationist discourse. So what do people really feel about the forests or about other ecosystems and about the conservation policies? And maybe also illuminate these sources of conflicts with park management, some stereotypes that were going on at the time, linking ethnicity and land uses and environmental threats, and then this emerging interest of mine in the lived experiences of climate change under conservation. What I really like about participatory photography and that I've experienced over several projects is that when you empower people to research their own realities, somehow photography works very well. Whatever information they share with you is shared voluntarily. People will not share anything they don't want you to know, which is a bit different from the setup of an interview. I feel that I'm always manipulating people to extract information. They're manipulating me. And so this is a feature of participatory photography I really appreciate. So the focus is the village of Kafal, an extensive village with 3 ethnic neighborhoods. I had contacts in the village from previous fieldwork. We came as a team, we introduced the project, we explained, we answered questions, and we invited volunteers. So it was open to the whole community, and in the end, we had a group with a broad age range, balanced number of men and women, and different ethnic groups. A very important point, I think, for the success of these projects is to use material that stays there. So the way for us to do it with limited funding was to use donated equipment. And I don't advise using disposable cameras because it's disappointing for people. They put effort into learning a new skill and then those cameras disappear. Ethics were a big deal. And we of course, we discussed these usual concepts of authorship and sharing, what it means to share and so on. But very interestingly, we use role plays to decide collaboratively what are the things that were not allowed. And the one thing the photographers came up with is that you were not allowed to take pictures in sacred areas. And so during the project, some cameras got broken, some pictures came out completely black, and it turned out that these photographers had taken pictures in sacred areas without knowing. So there was some cosmopolitics going on here. And we touched upon the topic of climate change. And of course, expectedly, people come up with, of course, we cause climate change. We cut down the trees. We are bad people. And because of that, rain stays away. And so expectedly, people, again, were deploying this external discourse that they've appropriated or that they expect us to want to hear. So instead of focusing on climate change, we decided to reach there somewhat indirectly by organizing small research projects on change. So photographers would document changes in the village, which is a setup they're comfortable with, and to get at environmental changes, we ask them to then, in the second stage, to look to document changes beyond the village and to indirectly get at rain, climate, possibly to document changes in water. And we did this over 4 months as an iterative cycle of shooting pictures and sharing the narratives. So photographers could work in groups or individually to take the pictures. And then we would have these small storytelling sessions where they would select 1 or 2 or 3 favorite pictures, and they would extensively explain why they took the picture, what is happening in the picture. And it always generated a lot of interest from other people in the village. It became a village-wide effort. And finally, and this was the photographers' initiative, they decided we must share our stories much more broadly. And so they organized this huge closing ceremony with cattle slaughtering, sound system, all the authorities, including the authorities of the park, were there. And the pictures were projected on the wall of the local disco. And what was really nice was to see women actually holding onto the microphone and telling more stories than their stories in the photographs. They felt quite empowered by the microphone and their stories. And now, in terms of findings on these pictures of change, I will focus first on these environmental change narratives, which is my interest, but then I will share what really matters to farmers. And you will see that it's not climate, it's not the environment. So what I found interesting was to contrast the discourse at the time on the environment of Cantonese and how it's changing. Starting with this proposition, the forests are decreasing, they're disappearing, people are cutting them. And to contrast it with this story that is also in the photo exhibit. And it doesn't look like much, but the photographer very expertly, on purpose, he took this picture of 3 ecosystems, and you can tell the image is incredibly balanced. So here is what he identifies as the forest, here the mangrove, and here what he identifies as the lala, the savanna. And the story is that, according to him, the forest is eating the lala. So instead of the forest decreasing, what he's telling is that the forest is increasing. And this is a story I heard elsewhere. And it's bad for people because it means as the forest is increasing, the savanna is decreasing. And it's bad for people because the savanna also has a lot of value, namely for thatching the roofs. Under park rules, people are no longer allowed to burn the savanna, which helps the regeneration. This was quite a frequent story I heard. Another proposition in this discourse is that farmers lack environmental consciousness. I read that in literature from the 90s. Here is one of these last remaining giants. This is a poilau, a very valuable tree, a wild tree. And this is a story of the same species. And the photographer, Paulo Nanfuta, explains, here is a poilau, the trunk of a poilau. The owner of the poilau, so it was a big poilau, cut it And then the same man actually put a seed of another poilão growing into the old poilão. So the story of change here is how a dead tree is giving life to a new tree. So to me, this sounds like a nice conservation practice. And again, I've heard these stories elsewhere. This is another story of change. This was a freshwater spring that was very, very useful for cattle. Unfortunately, like we heard in other presentations here, the seawater destroyed this freshwater spring. And before the seawater did that, there used to be crocodiles here, and kids would try to kill those crocodiles. And there were crocodiles here because one day an elder introduced the crocodiles there. The crocodiles reproduced, and this crocodile population became sacred, in the words of the photographer. Nobody was allowed to touch them. And elders would get really angry when kids were trying to kill the crocodiles. So again, I think this shows some, whatever, if you want to call it, environmental consciousness rather than a lack of it. And here I want to thank Bucar, because I updated here. I had it as Borassus etiopum. So after your presentation, I updated this. What we're seeing here is the Borassus, the sib, a very valuable tree for many reasons, like Bucar explained. It's very strictly protected in the park. You're not allowed to cut it, but it's very sought after. It's very valuable for many reasons. And this was a very surprising story to the whole group of photographers. Papis, the photographer here, he took this picture of a plantation of this wild tree. This is an old rice field that has been eroded. And the landowner decided, I will create a plantation of sib, again, which is a naturally occurring tree. So it is much more dense than what we see here. I actually saw that plantation. And the photographer says he's not doing it for himself or for his children. He's doing it for his great-grandchildren, because sib takes so many years to grow. But it's very economically valuable. And this is the visionary, Mr. Lodna Nawara, who planted these trees. He's an innovator, if you will, in the park. And so many other pictures of people deeply caring for trees. At least in this village, I was so impressed by every morning people would water the trees. Again, all these pictures are taken by photographers in the project. This is a tree nursery. This is a shower place, and shower places are also tree nurseries. So this is a village, at least this village, who really cares about trees and wild trees that they actually plant and take care of. This might look like a dense forest, or at least like a forest, but when the photographer explained, he said, it's a village. It's the old kafal. So kafal existed in one place, and then nowadays kafal was moved to another place. And this is the original kafal, where people planted lots of cola trees, mango trees, orange trees. So what we're actually seeing here are fruit trees that even chimps use. And finally, this is the story of an old store nearby a Portuguese commercial house where people would buy and sell their products. And it's also a story of change. It was good in the past, now it's in a bad shape. And what is very interesting, as you can see from these pictures, but there are many other pictures of wells, of more ruins all over, scattered all over the landscape, is how cultural this landscape is. And people really value that. Almost all of their very few pictures and very few stories are just about the environment or the beauty of nature. It's beautiful because it was used by people in the past. It's beautiful because it has value for us. So it's a much more cultural landscape than I think, than definitely I had realized before this project. So on one hand, there was at that time this external discourse on Cantaniège, which really focuses on forests to the detriment of other ecosystems that are valuable for people. It's all about fragmentation, extinction, degradation. There's this sense of urgency. It's a big crisis, and the solution lies in scientific knowledge. It's also very much entangled with development and conservation politics, and that underlies, at least back then, those human rights abuses that I saw, that I witnessed. But that discourse is also appropriated and deployed by villagers, at least in the interviews I conducted back then. And this photography project, to me, revealed the existence of a subaltern discourse where the landscape is extremely dynamic and historical, as I said, and it's very much shaped by the farmers' management and their conservation practices, and people really value this historical heritage, and they have a very deep knowledge of the ecological dynamics of the place. But what are the local perspectives on change? You cannot really see. So what really matters to the farmers? Education. This is by far the most frequent story in this body of work. You see several stories of education in the photo exhibit. And in fact, I did an informal survey after the closing ceremony, and I would ask people I would meet randomly, which story made the biggest impression on you? And almost 100% would say this story of this particular school, which is a very convoluted story, but how education is what people, it's a positive change in people's lives. And it's important because the latest management plan mentions that almost 50% of the population is illiterate in the park. Another not as much represented, but important story is this damaged lineage, the seawater. I won't go into it because other presentations, other colleagues have talked about it, but it's definitely a concern, the impact on livelihoods. But mostly, and that's what I find so encouraging, and was mostly it's about what people say are beautiful changes. A dirty place that is now under beautiful cultivation. The first engine boat in the nearby village that makes people safe in terms of health and taking kids to school and so on. Other examples of technological development like cell phones, machines to deal with the crops. Instead of climate change, people address how important clean water is thanks to wells with water pumps. So these narratives are very much focused on what is important for their authors and their communities. But again, asked in a different way. So after the closing ceremony, the local radio asked one of the photographers, what is the biggest problem here? And his answer was, climate change. And let's take our hands off the forest. And I know for a fact that this guy has never cut a tree in his whole life to plant rice in the forest. So we see this appropriation. So take-home messages to conclude. People are at the center of people's concerns and positive messages. Education and livelihoods are the most important. To tie with what Eric mentioned, the importance of history and asking people, learning from people about the history of where they live. And it doesn't coincide with these external observations. Back then, at least, I can say that conservation policies were underlying inequalities. Again, people have ton of knowledge of ecological dynamics. They have their own conservation practices. And I would like to finish by saying that to address wicked problems, besides interdisciplinarity, transdisciplinarity, I think is very, very important. So working with different sources of knowledge coming from different groups and communities. And I have lingering questions. When I did my photo voice projects, I was working with people who had never used a camera before, who associated cameras with white people. I am sure nowadays that smartphones are well disseminated in Cantonese. And I wonder how you can do photo voice in the era of smartphone and image overload. So, and then I ask myself also, how decolonizing is this approach when it is externally initiated, which was the case. I mean, I came up with the idea to do this project. Thank you very much to my colleagues and for your attention, and for DIAS for hosting the exhibition and inviting me. And thank you very much.
Thank you so much. Let's just have one short question, and in the meantime, Dominic can set himself up down here. So one question. Oh, no questions? Yeah, that's. Oh, you have.
Okay.
It's just a question, which picture was your favorite?
Oh, that's an excellent question. I'm so tired. I can't really think. Let me see. I mean, I have a soft spot for the environmental ones because I'm an environmentalist. But aesthetically, some are incredible, like this one, for example. So yeah, you know, there are the ones I like visually, the ones I like for the content. Let's see. And that's the beauty of photo voice. Sometimes you can have a really non-interesting picture that, you know, we would consider a bad picture. And then the photographer starts to tell an incredible story about, you know, the reason why he took the picture. And so sometimes there's no connection between the beauty of the picture and the beauty of the story.
Thank you.
Thank you for your question.
Thank you. So it's time for the last presentation today before the wrap up. Should you say that now?
Just say that so people are wondering.
Yeah, so this is not the last presentation today. Actually, we have a pop-up presentation in a second after Dominic. And after that, we also, I think we all really wanted to see the short 5 minutes video. So we'll do that. And then we'll have the wrap-up. Okay, but first, before everything else, the next speaker is Dominic Looms, who's going to talk on culture as the weapon. The floor is yours.
Thank you, Sue. And thank you, Dias, STU, and all of the organizers of this very timely event. I'd like to start by saying that I'm giving this presentation today in service of the Bijogos people. I don't pretend to represent them or to know ample knowledge about their culture. I spent the summer in Guinea-Bissau from mid-May to mid-August of this year. And these are my observations and findings. The trip was everlasting in my memory, and the Bijogos people are at the center of my presentation. So culture as the weapon is an inspiration, or like an adaptation from Amilcar Cabral and his revolutionary work on theory, and how he used the element of theory to liberate 3/4 of the country before his unfortunate assassination in January 20th, 1973 by the Portuguese colonial forces. But he stated how nobody has yet made a successful revolution without revolutionary theory. And he stated how theory is the the weapon for a successful liberatory struggle or a fight against what they believe, what someone believes is morally correct. So within this presentation, I see culture as a weapon not only for the Bijouas people, because they are experiencing many changes within their respective territory. Not only for the Bijouas people, but also for Guinea-Bissau as a whole, and for all of the many different ethnic groups. There are around 30 different ethnic groups in Guinea-Bissau, the Bijouas people being one of them. Amico Cabral also stated how culture enables us to know what dynamic sympathies have been formed and set by social awareness in order to resolve conflicts at each stage of evolutionary society in search of survival and progress. In other words, culture is a necessary weapon for the acclamation of new discoveries, not only within one culture but other cultures, self-proclamation, in other words, identity, and transformation, cultural transformation, social transformation, ecological transformation, and self-transformation and community transformation. Here is pictured here on the right is my good friends Sin and Nelson from the Nago community. And this picture was taken before the palm wine harvest. I should say also it's very timely that Bucar and I'm following Bucar and Joana because they have both inspired me in many different ways. And I'll continue by saying that this project is a preliminary study. So because I only spent 2 field trips this summer, when I go back, I hope to do similar work, such as like a photo voice or using visual and experimental media in service of the Bijouas people. I have a short video here to explain what I mean by the Cabral elements. But I'd like to also mention about the importance of historicity, which Martin Heidegger used Geistlichkeit, which I don't speak German, but which is translated to historicity, to describe human existence, in other words, Dasein, as fundamentally historical. Similarly, the ex-president of what was it? Ghana, Kwame Nkrumah situates African identity as historically constituted, shaped by the forces of colonialism, tradition, and global modernity. Africa being Africa cannot be understood outside of the confines of colonialism, because it's fundamentally changed the structure of Africa and the structure of the people.
Peuples africains de cette Afrique bafouée par la...
Camaradas, fala o camarada Amilcar Cabral, secretário-geral do partido.
Nous sommes des peuples africains de cette Afrique bafouée par l'impérialisme et le colonialisme pendant des décades et en quelques cas pendant des siècles. Nos pays sont des pays économiquement arriérés. Nos peuples se trouvent dans une étape historique caractérisée par cette condition arriérée de notre économie. Nous devons être conscients de cela. Nous sommes de cette partie de l'Afrique que les impérialistes ont appelée l'Afrique noire. Oui, nous sommes des Noirs, mais nous sommes des hommes comme tous les autres. Nous avons notre cœur, notre tête, notre histoire. Les colonistes ont l'habitude de dire que eux, ils nous ont...
So that was just a short excerpt from a larger video, which I can show with you guys after if you're interested. But it's important to note how history shapes the people as well as the culture. And notably, Salazar, the dictator of Portugal at the time, said that Africa has no history, or Africa has no history without white people or without white colonialism. So Cabral attempted to challenge that and reshape it and to create a new history for his people. First, I'd like to, before I go in, I want to first acknowledge two very special people that have allowed me to do this work. One of them being Bucar. Bucar, so I should say I'm a social and environmental anthropologist by training. And the elements of plants within this presentation was inspired and Bucar sowed the seeds for my interest for ethnobotany. The picture on the left was shot outside INEP, where Bucar is the director for plant studies, and the one on the right was shot inside inside the school. Secondly, this is my good friend and my good brother Nelson. Nelson is my main point of contact and the reason that this all happened, because without Nelson I wouldn't have seen the islands, or I wouldn't have been able to see or be with the community for such an incremental stage in my life. So I want to say a shout out to Nelson as well. So this is on the left is from he's building a new house for himself and his family, and this is me inside the house, and this is Nelson outside. And on the right is Nelson fishing in the mangroves. So this is a map of Guinea-Bissau, and encircled is the Bichagos Islands. I've never used this before. Anyway. Oh yeah. E here is the Aroc Islands. So we would travel from Bissau to Bolomba, and then, which would take like 2 hours, and then we would travel by canoe to the Aroc Islands, which would take around 2 to 2.5 hours, depending on the weather. So the Aroc Islands are made up of 3 main islands. Chidia, Formosa, and Nago, and they are part of a much larger set of islands, which are called the Bijagos Archipelago. And the Bijagos Archipelago is made up of 88 islands, but only around 21 or around 24 of the islands are permanently inhabited by the Bijagos people. The remaining islands are used for ceremonies, rituals, agriculture, and the Bijagos people have a affiliation to animism or spirit, which I'll touch upon later because this is changing. But they have affiliation to the spirits called Irans. And the Irans historically and traditionally govern the life world and the life practices of the Bijagos people. And they believe that on certain islands, the Irans are live there, and they, if for example, like tourists or people who aren't from the Bijagos community, or they don't have affiliation, or they don't have permission, they will be affected by the Irans. So, for example, similar to Joanna's presentation around like people taking photographs in sacred places, you have cases where people's cameras have been have broken, or their photos are completely black as a result of not respecting the permission from the Bijagos people. The islands are rich in diverse typographies, being forest, desert, or oceanic, coastal, and they support human and more than human livelihoods. They are inhabited by the Bijagos people. The social structure of the Bijagos culture is traditionally matriarchal. I will speak also about this, how it's changing, and part of the cultural struggle. And there is a deep connection with spirit, land, and sea. Notably, the Yurok Island community, the Yurok Island communities, the Yurok Islands have been made a community marine protected area, and it was established in 2005, which is the first of its kind in Guinea-Bissau. And more recently, in July 2025, the islands were formally designated as a World Heritage Site. And this was coined by the local people, known as Omati Mino, or translated as coastal and marine ecosystems of the Bijagos archipelago. This is a photograph I took on Nago Island, just to give you a glimpse of the beauty and of the landscape. And this was back in June 2025. And pictured here on the left is assortment of different plants and crops. In the bowl you have African rice. On the top you have chibu, or the palm fruit that Bucar explained. And you have a type of legume or bean on the bottom. And on the right is medicine preparation. And here you can see on both pictures, this is called the lugar, and the lugar is where people, Bijagos people, practice slash and burn agriculture. So slash and burn agriculture is used to designate more space for cropland, and they'd plant particularly rice and other crops here. So the essential foods for cooking and cultural identity within Bijaga's culture. So you have more, but these are the main ones that I found, which are rice, ground nuts, primarily bambara nuts or peanuts, beans such as pigeon and lima bean, which are the most popular, shellfish, mostly oysters, which are harvested by the women of the community, fishing, which is primarily subsistence, which means that they're able to catch the fish, but they're not able to sell because of the quantity of the fish, and also the means to sell and the transportation costs to Bissau. Sorry. So the following videos I don't have sound for because my microphone got wet during the rainy season, but I thought they were still appropriate to show the production phases of food. So this is preparing flour made from a particular plant. And I have a similar soundscape from this time, which I was able to save, which I'll talk about during the language section. I particularly like this video because it shows the elder and the younger generations partaking in this. Mostly during the harvesting and production, women would come together and they would sing, which I'll show later on. This is Francisco. He is from the Papel ethnic group, but they have like separate tabancas from the Bijagos people, and so this is this highlights how there is like a mixing of diversity on the islands. And here he's harvesting the palm fruit. This is Sabado preparing the manioc leaves for lunch. So this is about the medicine and the ethnobotanical importance of plant preservation. So traditionally, plant wisdom supports community healthcare, especially where biomedical access is limited. Geographically on the islands, this is very difficult for the communities to have access to the health. So plants are alternative, as Bucar said. Ethnobotany guides community medicinal and therapeutic paths, and it also is a step for scientific knowledge to adapt from and also work with. Contemporary societal ruptures on the islands, I believe, can be counteracted through plant practice. This is Musa. So as Bucar said, there are different people on the within the medicinal or health practices, like traditionally, that are aware and have special knowledge about plants. So this is Musa. He's a curandero or a healer, and he specializes in the antidotal properties of snake bites. As you can see here, we saw a snake on the plantation, and he was quick to to kill the snake, because snakes can be deadly. If you're bitten, you mostly have like around 2 hours if you're not treated. This is Nelson's elder brother, Rapaz. This is him preparing, he's also a curandero, and he was here preparing medicine for someone who had been feeling tired for many days. So he's preparing like a balm from the plants. Here are some examples of the plants that Nelson and I found within the forest. So Kinetus ferruginea. So all of the plants have many different properties, but this one is good for oral hygiene. It's an anticonvulsant, and the chewed fruit can also be helped for teeth brushing. Cassiphia filiformis is good for childbirth and eye ailments, as well as other things. And Revolva vermitolia is good for hypertension, scabies, wounds, and it's also a ritual tonic. And lastly, Piloostigma foningi can treat malaria, and it's a general body pain antidote. And here you also have the Creole and the Bijigo linguistic translations as well. Onto the language. The Bijigos language is very unique. Historically, it's an adaptation from West African languages, such as the Atlantic coastal, Senegabian and Bak languages. You have 7 vowel sounds, the I, E, E, K, O, and U. And the consonants, you have 18, including the rare lingual labial stop. Noteworthy, the Kajugo dialect is very distinct. And within the Bijigo dialect, you have communities that can't understand the Kajugo, so they need to use Creole as an alternative. You have many contemporary changes within how people are speaking within the Bijigo communities. People are opting to travel to Bissau, mostly for like economic and educational purposes, because they don't have access to these facilities on the islands. So they're learning Portuguese at school, because that's the educational language. And because of the many different ethnic groups, you have Creole as like a mediator between the many languages. So many people are now understanding Portuguese more. They're fluent in Creole, and the younger generations I found, especially within the Iraq Islands, some of the Bijigo people aren't learning Bijigo anymore because of these modern changes. Bijigo and ecolinguistics. I don't see language as strictly a speaking or behavioral phenomena. I took this picture on Nago Island, and you can also see it, you can almost see like a facial element to it. And I see it as like the energy or the language of the fire. Language is important not only for conversations, but also understanding landscapes. You can have language resilience if you see language as like a means to understand the forest, understand cognition, or understanding a certain place. And language can also be used for conservational practices. For example, if you have a particular plant or a particular ceremonial or cultural element that is embedded into a culture, the language can help people understand that more. So this is Naga Island, and Nelson and a man who I only met briefly, but he had quite a indelible impact on me. I believe he was a Curandero, but he spoke and walked with a certain knowing that you can only really, that is quite rare in this world. So the struggle is related to the spiritual and cultural changes, but it's also linked to the churches. So you have Brazilian missionaries coming to the islands, particularly within the early 20th century, and this is changing the entire cultural and religious makeup of all of the islands. Everyone that I spoke to, they stated how I asked them, like, what is your religious identity? And they would say either Christian, Protestant, or evangelical. So you have like this new like religious makeup that's dominating as a result of the churches, and the churches are also paired with education. So you don't have education on the islands without the churches. So this is something that the Bijagos people need to balance and critically think critical of. I see eco-Marxism as a tool, as well as eco-linguistics and culture, to change the metabolic rift between humans and nature. Eco-Marxism, when framed with traditional ecological knowledge, is resisting the capitalist and industrial system, industrial complex. And it can also support cultural continuity and ecological stewardship. So Marx talks about Macht, or power, and power can be tied to domination or rule, or Herrschaft. Herrschaft can be capital, relation of exchange or certain machinery. And because of the geographical distance on the islands, the Bijagos people see like there's this like identity distance, but also this sort of like longing to be in Bissau, and the elements of like capitalism can be quite alluring for them. So I want to finish by focusing on Cabral again. He said some people get used to the war during the liberation struggle, and once you get used to a thing, it's the end. You get a bullet up the spout of your gun and you walk around. There's appeared a certain attitude of militarism, which has caused some fighters and even some leaders to forget the fact that we are armed militants. So he's juxtaposing militarism and armed struggle against what they see as a negative impact on their cultural identity. So I use this quote not to say that we need to all own a gun, but to think critically and use the weapon of our mind to think critically, and to use culture as a critical tool to fight things that we believe at our core isn't correct. And he also said culture is simultaneously the fruit of a people's history and a determinant of history. So culture can change history, and it can be the tool for a new history. I want to show these two images to indicate the more than human elements, which I wasn't able to expand upon, and also the already existing resilience that is within the core of the Bijagos people. So Otunete Toyono Bidi means my brother in Bijago. This is my brother Augusto. And I also want to challenge the concept of inequality, because If we say that we want to focus on challenging inequality or like we want to work towards like correcting the inequality, I feel like if we focus on diversity, we can have much more fruitful conversations. And lastly, these are important organizations that are doing incredible work. Thank you.
Thank you so much, Dominic. Yeah. One question, and then I'll leave the microphone to Søren to chair the rest. Joana? Sorry. Yeah. Sleeping.
Thank you. Thank you for a very nice presentation. I was curious about the language of fire. What do you mean by that? Or is it a local concept? You had an image of a fire.
Yeah.
And
yeah, like it's like the four elements. So like water, air, fire, and earth. And language can almost like breathe or speak. Sorry, fire can almost like breathe or speak when it's alive, when it's sparked. And I see that as like a language of like, or a way of the fire telling its own story, because within the storytelling of original peoples, they don't see things as inanimate. Everything is animate. Everything's alive, and language is animate as well. And everything that we see around us is derived from nature. So if nature is alive, then everything is also alive. So I see fire as a language of aliveness.
thank you.
Yeah. Okay. Thank you so much, Dominic. How it works. And just on the last part, that's actually some of the linguistic work done at this university also had to do with like connect to some of these diverse epistemologies of language. So to like escape this very narrow European, Eurocentric idea of what is language. Yeah.
Thank you. I'll just take over the mic just for a short introduction, because we had, as Sune alluded to, we had a little pop-up event, and actually it's my bad that Gaia and Joanna didn't get a space on the program, because we only learned they would come very late, and I should of course have taken the opportunity when we had a cancellation from Namir to have you officially on the program, but you have graciously accepted just today to be giving a short presentation, even if it's unprepared, just to introduce yourself and the work that you have been doing in Guinea-Bissau. So Gaia and Joanna are good friends and colleagues from Guinea-Bissau, but actually originally from Iceland. And oh, you have actually prepared a few slides. Let me just bring my computer. So I hope everybody can stand a little bit more of intellectual work used. I loved your quote, Dominique. Use the weapon of our minds. So yeah, sharpen your weapons here and be prepared for just a very short last presentation.
Promise not to be too wordy.
We had decided to
you need a microphone.
our presentation. I'm happy to be here. Thank you so much, Christina. And I will tell you, we have decided to concentrate on our most recent work with focus on inequality. The theme of this.
Can you give a short, while I find the slides, maybe give a short introduction? Of
Yeah,
yourself?
I'm a professor emerita of anthropology at the University of Iceland, trained in Stockholm as anthropologist. Yes, you. I have the first
Yes.
This is the presentation. I am a medical doctor from Iceland. I came to Guinea-Bissau for the first time, 1982, met Peter at that time, and I was doing health center work in Bissau for 3 years.
And I was working in my capacity as having BS degree in chemistry. And I was teaching students or technicals of laboratory.
The Bissau adventure took us to Stockholm. I did my PhD in pediatrics and based on work on Guinea-Bissau.
And I did my PhD in Stockholm as I'm trained in anthropology in Stockholm about mother grief when children die in Biombo.
Basically, this is a short introduction to then I from the medical side, she from the anthropology. We are here together working on child trafficking in Guinea-Bissau. That was 2009 in Quintana. And all over the country. But that's another story. But just to emphasize, we come from two different aspects.
We want to tell you about our last 3 doctoral students. First, we have Fatu. She will defend her thesis in November or December. Because of that, we can't go to Guinea-Bissau in... No, this is Boaro. Okay, Amadou Boaro, that's the child trafficking paper. It's about the very much controversial issue about Taliban children, about begging of children, etc., etc. I will not go into details. All these articles should be in open access. This is Fatu, another doctoral student of Yale.
So Fatu is my doctoral student. She is defending her thesis now in end of the year.
Boaro will defend his thesis in end of October.
But anyway, shortly, she has been trying to understand manifestation, analyze manifestations of inequality in the lives among adolescents in Guinea-Bissau. We have been looking into access to schools. We have been looking into digital access. We have been looked at their lives during the COVID pandemic. And now the latest paper just now in June, photo voice project. Very small photo voice project where they got, unfortunately, disposable cameras. But anyway, it was an attempt to make their voices heard.
And they identify in her last paper education as very much sector of inequality. And I forgot to mention Boaro's thesis is very much about power struggles at global and local level, but also locally, and a lot about inequality.
And an interesting aspect, because we are talking so much about environment, these young people, 16 to 19 years old, they identify environmental issues as very important for them. Degradation of the Bolanias, waste is a huge problem.
And so, they come from Bissau.
They come from Bissau.
My last doctoral student, John Edmund Bollum, he is already active. He has written one paper about aspiration for higher education, where he can see that the girls are surpassing the boys in aspirations to study at university. And we have a lot of data, both quantitative or qualitative, and it will focus very much on the trajectory and pathway to university, and there is a lot of local and global inequality in that thesis work. He has no day for defense yet. We have been concerned with children quite a lot, and this is a very recent discussion about child labor and children's work and controversies around definitions of what are children doing when they work or are engaged in child labor. And in Jon's data, I can tell you There are a number in the qualitative interviews with university students on the second year of university. Without child labor, they would never have entered university.
So it's important, and the work on child labor in Guinea-Bissau is based on mixed study, accessible to everyone who wants to. We looked at 5 countries, and Guinea-Bissau, 1/3 of all those 5 to 17 years old, they were defined as child laborers. That is about age-specific limits. So about 1/3 is working more per week than they should do. We have been also looking at some of the issues on narcotics, substance, tobacco, water pipes, and see what are the determinants. I mean, it's boys, and what we find is quite interesting to see. Smoking, very much boys, girls very low, cigarette, but water pipes. It's an epidemic in Bissau now. Those of you who have known Bissau, water pipe, shisha, is the problem.
And those more likely to smoke water pipes have a somewhat better economy than those who are not smoking.
And girls and boys are equal. So it's a result of very intelligent marketing. And we are trying to, like you, we are trying to inform about our results. We are publishing, we are in the radio, we are having conferences, we distribute reports, we do what we can. And they come to Iceland, have presentations in Iceland.
Our collaborators.
Our collaborator, Alace Balde, he is the rector of Jean Piaget University, and we have been collaborating for over a decade. And he is there with Amadou Buaro, with the University of Iceland, rector of University of Iceland. We are working with INEP, Seka Shandi, who is the director of INEP for the time being, at least. And so, yes, those are our very important, great collaborators.
And finally, I want to pay attention to the doctoral thesis of Sigga, or Sigrid Baldursdóttir, who has written about the community health South de Base, Guinea. And then I will also pay attention, thanks to Sabine, I got to remember that report, about evaluation of the Bamako initiative. And you won't not find neither of these on the internet, so just write me if you want to get a copy. Yeah.
So that was all. We are happy to be here, and thank you so much for inviting us to jump in with just a few words. Thank you.
Should we just check if there are there any questions for Guy and Shonina? Yeah, I'll bring you the mic.
Thanks for being so kind to your doctoral students. Much appreciated. I was very curious about the study about child labor. I think there's always a lot of myths about child labor in Africa, and I'd like to understand what you understand by labor.
I said child labor because those are the definitions by UNICEF, International, what is age appropriate. We come from Iceland, and we don't. And we don't
I know
buy,
a lot about what we call child labor today.
Yes.
But the second is a kind of comment. It's about the artificial line between child work and child labor. And in a way, the very negative discourses around child labor which, whether we like it or not, help many children get education.
And also, I would really say in Iceland, when we were doing this work on child trafficking in Guinea-Bissau, we asked ourselves, this is a custom, has been for decades and years in Guinea-Bissau and all of West Africa. What type of custom in Iceland would be qualified as child trafficking if we would use the same definitions on Icelandic culture as we're using on Bissau-Guinea culture? It's a difficult discussion. It's but the thing is that we have in Iceland, and we have written books about it, about following this work on child trafficking in Guinea-Bissau. We have written a book on child work in Iceland.
And we have done research, qualitative and quantitative, about the custom in Iceland to send urban children to rural areas during the summertime, where they worked. And they were even driving tractors at as young as 8. So for us, child labor is a very complicated issue, and there is a lot of, among researchers within children's welfare, and there is a lot of questioning of the criminalization against children who are confirmed to work child labor or being child laborers in line with international definitions. So there is a lot of controversy about it. It's the same with child trafficking. The title of Boaro's dissertation is "Trafficking is a Heavy Word." It's a heavy word. And the dissertation, and everybody argues, going to Quran school is a matter of searching knowledge, becoming liberated, and the road to power.
I think we can, that's material for further discussions. Thank you very much for popping in. That was wonderful, and great to have you here. And you'll be around tomorrow, and we'll come back to tomorrow's program also later. But for now, Orlando, can I just start your video here? Yeah. 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 It's about your project there, and we have a little 4 minutes. Yeah. Yeah. Yes. Okay. It doesn't seem to. I'm afraid this is above my area of expertise right now. I suggest we move that video for tomorrow for those who are present tomorrow. And I'll just make you all aware that in case all the presenters accept, we will have the presentations uploaded with the video of the seminar, so everybody will have a chance to see the video by following the link there. So for now, I just want to, well, my computer doesn't work right now.
No, I don't think the network works.
Okay.
I think there's some network issues, so I think that's the reason.
Okay.
Thank you, Christina. And it's of course odd that tomorrow we will technically meet in the basement of Babel on the top of a tower. But when we planned this event, it was out of sort of the idea of humility and not to sort of make ourselves and anybody else believe that we could actually construct sort of highly superb solutions to all the issues and problems. No, let us not commit the hybris of sort of overestimating our own ingenuity and power, but let's stay in the basement of Babel and then just engage in some exchanges and discussions. And Thank you to all presenters and to people asking questions today. It's been really interesting to follow, and we've had exactly that sort of kaleidoscope of perspectives and presentations, disciplinary backgrounds, etc., that we had actually hoped for, and we of course also sort of planned for when inviting people of different backgrounds. Wrapping up is probably, okay, how do you do that in a few minutes? But let me try to make a drawing, maybe because we started out hearing about sort of the complexities of the healthcare issues and healthcare systems in the Guinea-Bissauian context. By Sabine, and I think that complex systems is one of my own sort of favorite wicked issues and problems. So let me stick with that and try to sketch out some of the perspectives and some of these intersectionalities and interrelationships that we've been through. It's obvious that Guinea-Bissau is located somewhere in this world, and it's yeah, it'll be bigger. I need a okay, all right, the black one, that is the color police. Yes, but there's a point in using different colors.
I'll check out the functioning ones.
They are off. I checked them. Yeah, it's just so Guinea-Bissau is here. And the starting point of this, endeavor that we embarked on was the impact of climate change in the health profile or the health care system and the health situation in Guinea-Bissau. And from there on, we went on to a lot of other issues and problems of various kinds. But it's obvious that there are people in the white world that put pressure on the water that makes it rise in the Guinea-Bissauan context, despite the sort of funny picture. This is, metaphorically speaking, the reality. So there is a global flow or a global exchange of processes which deals with the sort of climatic physical conditions, right? That circulate and that makes, that has consequences, the burning of coal in China, the burning of fossil fuels in Europe, in North America, in India, wherever, does have consequences, as we have seen, rising sea levels, et cetera, in the Guinean context. Obviously, we can use the black for that. That's, I think it's a good idea. We all know that there is a system of global trade, of production and consumption exchanges that actually is behind the climate issues that we are experiencing, and that this system and its inequalities, its unequal capacities of being inclusive and exclusive of different populations under different conditions is also shaping the realities of Guinea-Bissau and the pressure on local rice production, the dependency of imported rice, which makes it problematic when climate change elsewhere threatens the rice harvest in Pakistan or Thailand. All of a sudden, Guineans cannot survive because global market prices of rice go up. Right, so it's not just the local disasters, but the global disasters in the global climatic trade, production, consumption system that is causing particular issues, problems, and worries for Guineans. Now, on top of that, of course, we've also heard, I guess green must be good for that. We also have global or glocal. All of these globalities should actually be localities. Ecosystemic relationships, we have seen how, you know, the coastal areas of Guinea-Bissau are linked to the Arctic through migratory birds. It's an important stopover in a global ecosystemic connection. We have seen how the changes in local ecosystems, again, depending on climatic change processes, makes different kinds of forest expand, the savanna goes away, etc., as Joanna's informants pointed out. So all of these ecosystemic changes and processes, let's call them global, right? So that's more correct, is also both globally and locally a systemic embeddedness of the life conditions and the possibilities of Guineans. And then finally, I think in a number of ways, we also have a number of global social flows, FLOWS, as also the last presentation pointed out, Quranic school children. So we have, and how to make sense, or how to sort of present that. I'm a sociologist by training, turned into some kind of pseudo-anthropologist. So I couldn't help thinking of Apadurai scapes. So the British Indian anthropologist Arjun Apadurai talked about how the global world is characterized by not just by geographical landscapes, but henceforth more by other kinds of scapes. Excuse my handwriting. So Apadurai refers to the characterization of the global world as a mixture of different ethnoscapes, and these ethnoscapes are of course constituted both by Guinean diaspora in Portugal, by the diaspora of rural population into the urban areas, by the kaleidoscopic constitution of ethnic groups in one nation state, by the presence of United Nations and other expat helpers, by all kinds of flow, and not so much in Guinea-Bissau, but many other places, by the introduction of tourism, and tourists as a very, very powerful global force. So ethnoscapes, technoscapes, from the drones of this morning to various kinds of technologies that we have seen, both local and global one. Financescapes, which is a little bit different from the production and consumption flows of trade. By that, Apadurai refers to the access or not to capital. Is there any money and is there any profitability, of course, in the capitalocene system under which we don't thrive? Financescapes is possibly one of the most thoroughly globalized and thoroughly destructive of these scapings. The mediascapes, wonderful photo with going from letters to the cell phone in your photo auto elicitation technique project that I was highly inspired by. Of course, the current mediascape also shapes the positions and the ideas locally, as we could hear so many times. There are global ideoscapes, ideas of conservation. Oh, yeah, there's conservation. There's ideas of colonialism. There's ideas of religion, Islam as a factor, as we heard about in the last presentation, etc., etc. So there are global ideoscapes at stake. And in the middle of everything, we have the Guineans, and there's a lot of consequences, as we have seen, locally some of them positive, some of them less positive, a lot of them quite ambivalent and ambiguous. And I think that's part of the complexity. It's very difficult to sort of paint portrayals of the world in black and white. We must think these ambivalences and ambiguities. But it's obvious that there are different intentionalities and power games. Eric mentioned the sort of the wicked intentionalities. We should not expect local governance structures, for example, to be benevolent towards the population. They may be inscribed in very different types of power games on the one hand, but it's also obvious that there are very valuable heritages and competences that exist in that local context. And we have seen a tremendous amount of wonderful examples of indigenous competences, resources, et cetera, et cetera. But as we talked about in the break immediately after, there's always this dilemma with these kinds of resources, that the more you make the outside world aware, the more is the prevalent threat of commercial exploitation, of squeezing out the local, we've seen that time and again, of squeezing out the local population in order to commercially exploit and internationally gain profitability from such indigenous resources, right? So it's a little bit like my own picture. So I said it's a little bit like when you read in the travel section of your weekly magazine or your newspaper. Here is this little undiscovered fishing village in Portugal that you should visit, and of course then it's already too late, right? So there's this dilemma in pointing out resources, is that we live in a time and a global dominance of what eco-Marxists, where's Dominique? He was here. No, he's still there. What eco-Marxists have called the capitalocene, a global shaping of this world based on capitalist production logics and processes. So I think when I think of the things we have heard about today, they are not all there, but they're somehow, at least as to the best of my capacities, and they are not very good. These are some of the processes, and of course, it's very difficult to foresee. Okay, we can just isolate. It's a little bit like the vaccination issue that we started out with. We can just isolate one factor, one connection between two elements, and then do the injection, and then everything will be fine. No, there are systemic consequences of all interventions that we can possibly think about and make. And there is what one of my mentors at Gamoin calls the ecology of action, that we cannot foresee these systemic consequences. And we must sort of act with that ambivalence and incertitude whenever we are making interventions of various kinds. And I think if this workshop can just make a small step towards trying to map some of these interrelationships between all of these natural and cultural, to repeat a distinction that I don't believe in, systemic organizations, then we're already a good step ahead of much of the interventions that, as to paraphrase my good friend Eric, that do more harm than good, right? So that's a starting point. Then with the mobilization of the indigenous, of the local knowledge, of the people that are there, maybe we can plan for processes that will also make a difference locally. But that's a modest wish. I hope that nobody felt too excluded by this summary. I'm sorry if I did. It was unintentional. I wanted to include everyone. So thank you for your attention. And Christina, do you want to say something about meeting point and meeting time and practicalities tomorrow?
That was fantastic, Søren. You exaggerated my expectations, and they were really large. Now you have basically, I think we have the skeleton for our white paper. There were so many things here that resonated so much with what the capacities in the room here, and yeah, you really managed to draw the essence, I think, and put it up on a higher level. So thank you so much, Søren, for wrapping this up in such a meaningful way. I think our heads are completely full by now. At least an introvert person, I think I need to be a little bit introvert just for a short period until 6 o'clock when we meet in front of the SDU restaurant, which is up in the main building, right by the entrance. So if you go up to the entrance of the university there's a big staircase going down and out of the university. If we meet there at 5 minutes, well, 6 o'clock basically, then we will be all good. So now a little time for free play. Those of you who didn't sign up for the dinner, I think we still have room for you. So just join us. We'll figure out. We'll share the food in the in a collaborative spirit. Yeah. So sorry. For those who don't know the university, it's up the staircase, follow the corridor to the main corridor.
To where the library was. But instead of turning right for the library, you turn left, go all the way to the end.
Okay, thanks.
Yeah, and ask for the main entrance for the university. That is where we meet. Yeah. Thank you so much, and see you soon again.